All right. Thank you, committee. Any comments from you, Chairman Coe?
No, I'm fine. Chairman Northup, I want to thank the committee for for great work yesterday. It was a relatively long day, but we got a lot of work accomplished, and we'll see how you do today, keeping us moving.
All righty. Well, with that, let's go to roll call for day 2.
Senator Ellis. I see her connecting now. Senator Ellis.
Present.
Senator Hutchings.
Here.
Senator Landon.
Here.
Senator Rothfuss.
Here.
Representative Brown.
Here.
Representative Connolly.
Here.
Representative Flitner.
Present.
Representative Freeman.
Here.
Representative Obermuller.
Here.
Representative Paxton.
Here.
Representative Piperinen.
Here.
Representative Simpson.
Here.
Co-Chairman Coe.
Here.
And Co-Chairman Northrop.
Here. Thank you.
We have a quorum.
Very good. All right, we're going to start off with item number 12, COVID-19 pandemic discussion. And leading that off for general background will be Matt Wilmarth. Matt, we'll turn it over to you.
Thank you, Mr. Chairman. This topic comes to you from the Management Council. They assigned several topics to standing committees to study items in relation to the COVID-19 pandemic. So there are 4 subtopics in this major topic today. And the first one is related to healthcare education opportunities at institutions of higher learning in Wyoming. And so we have staff from the Community College Commission and the University of Wyoming to discuss those healthcare programs. We also have under the second item, community Wi-Fi and telemedicine and teleeducation. Staff from the Department of Education, Enterprise Technology Services, Wyoming Business Council will brief the committee on that. Before that, Stephen Johansson from the Department of Health will discuss telehealth programs within schools. And that has been a priority from the presiding officers to this committee to study that as well. And then after that discussion, the Department of Education and the Governor's Office will give a kind of a status update to the committee on their respective responses to the CARES Act and funding associated with that. The Department of Education will also touch on food service programs within school districts as it relates to this COVID-19 pandemic. With that, Mr. Chairman, I believe the Community College Commission staff will review their memo. This is one item that is not within your notebooks. It is online. It is meeting material item 12-03, and it's a memo regarding the health programs at community colleges and the nursing program. So with that, Mr. Chairman, I believe Director Caldwell is in your meeting and ready to present that.
Welcome, Dr. Caldwell. How are you doing today?
Good morning. I am doing well today. Thank you for having me here with you all this morning.
Thank you for making it.
You bet. And Mr. Chairman, I also have with me, I believe I saw him, I'm not quite sure, looking on my Brady Bunch screen here. I think I have Dr. Ben Moritz is with me. And then I also believe that there are representatives, I believe, Mr. David Bodley from the University of Wyoming and the Renew program. And then I believe Dr. David Jones, the dean over at UW, is also here with us.
Welcome, gentlemen. Thank you for coming.
Thank you.
Mr. Chairman, do you just want me to get started on this topic? I'm happy to do so.
That sounds great. If you would, please.
Yes, sir. Mr. Chairman, members of the committee, we provided just a summary document for you related to the nursing programs at the community colleges and how that ties into the Renew program, as well as some information around the capacity of the nursing programs, the current existing nursing programs at the community colleges, as well as really a comprehensive list of the other types of health programs that they have. So I'll just start with the associate degree nursing programs at the community colleges. I think you all know that the community colleges have quite robust associate degree nursing programs and LPN programs. They also offer CNA programs. However, it's the associate degree nursing that really gets those RNs out into the workforce. So the community colleges, I will tell you, do have the ability and the desire to expand the nursing programs at the colleges. However, that is always dependent on the WIN faculty funding that is within the statute. So I'll just mention that. That was not fully funded actually in this last legislative session. It's a bit short of the full funding for the faculty positions for their salaries and benefits to the colleges. Those are slightly impacted. I also want to raise this point. There are expansion plans at both Central Wyoming College, at their Jackson campus, and then also at Western Wyoming Community College for the expansion of their nursing program that are actually dependent on projects that are in the CapCon process. The commission did just approve its CapCon prioritization yesterday, and that is we have the state construction department now, and it does still include those projects in the list as you've seen before. So I just want to pause for a second and just tell you that within the WIN program, which is the student side of the program, there have been 448 students that are either in school completed or in repayment. And out of those, there are 5 who are pursuing advanced degrees that allows for the nurse educators. And we have 2 applicants that are in the works, and they should be starting in the fall of 2020 to provide that advanced level for the nurse educators. So that's at that associate level. I think there is great interest in the ability to expand. That does depend on the WIN funding, and in the case of Western and Central, that does depend on the CapCon projects that are out there. In terms of the Renew program, the bachelor's degree in nursing is one of the examples frankly, in this country of how the community colleges and the university can work together. So the ability to deliver the bachelor's degree already exists and does so through the University of Wyoming in the BSN Renew program. And I'm going to let Mr. Bodley talk about that in just a moment. If the community colleges were to pursue a bachelor's level degree, it would actually be a duplication of services. Not to say that they might not approach it in some way. It's certainly not appropriate through the Bachelor's of Applied Science process. That isn't really an appropriate modality for that. And there would certainly be consequences, because then it would impact what we already have with the Renew program. And there is a limiting ability for the clinical component of that. So if I may, Mr. Chairman, I would like to turn it over to the University of Wyoming, and they can explain that in a little bit more detail than I think I can. Would that be okay?
That sounds like a good idea.
Good morning, Mr. Chairman, committee members. My name is David Bodley, and I'm employed at the University of Wyoming as the BSN completion director. Our programs, essentially the associate degree students to which Dr. Caldwell referred, and also registered nurses that intend to finish their baccalaureate degrees. Just by way of review, it's not generally known, I don't think, by the public that registered nurses can be prepared for practice by both associate degree programs and baccalaureate programs. However, all of the nursing educators in our state understand well the value of a baccalaureate education, and as such, we established this Renew Collaborative about 10 years ago. Am I heard okay by everyone?
It's pretty
Is my
broken up.
volume on?
We're getting 90% of it.
Okay. We'll assume that 90% will work. I'll speak more slowly. We have a program in our state that we refer to as Renew that is a collaborative of the nursing education, prepare nurses for practice, registered nurses for practice. We also have agency partners and others. Dr. Caldwell mentioned this is a unique program across the country in that we have participation of all of the community college programs and university. So let me give this a moment to catch up. So we are a curve in terms of educational preparation of our nursing workforce, and reaffirmed today with, or I reaffirmed this week with the directors of the associate degree at the community college that I should in fact speak on behalf of the collaborative. So my university hat is sitting on the table with me, and I'm speaking on behalf of the nurse educators, the nursing education programs state. The talking points that Dr. Caldwell brought are acknowledged by us as well. It's a more efficient system for us to prepare and offer our nursing workforce the baccalaureate degree through the Renew Collaborative. The University of Wyoming is the only institution in our state that can get a baccalaureate degree currently, but even were college community nursing programs established participate with us in the Renew Collaborative. So given that my connection is not that great, I won't add any talking points. I would just want everyone to know that my goal here is to raise awareness of Renew and the fact that Wyoming is ahead of the curve. The nursing educators are well aware of the value of baccalaureate preparation. And we have spent this last decade putting Renew in place, and we have graduates now in workforce in Wyoming. The pipeline that we have, there are, and Dr. Caldwell also referred to expansions that are in place, and Eastern Wyoming College added a nursing program in the last couple of years. These are all efforts that are supported and championed by Renew as a college. West College has also added a new option, and Eastern also added an option to provide associate degree nursing education. And then our job at University of Wyoming is to offer the that pipeline to those students. So the number of seats, associate degree and baccalaureate degree nursing student seats in our state varies year to year, but is somewhere between 350 to 400. These latest expansions, and current enrollment at the University of Wyoming in the Renew completion option is close to 300. So the system we have in place is a really good one, and I just wanted to make clear to everyone that the nursing at this curve and doing our best to serve the needs. So I'll end there and thank you all for your service.
Mr. Chairman, I believe you are muted.
Thank you. Thank you, David. Dean Jones, do you want to clean it up?
Yes, please. Thank you, Mr. Chairman. First of all, I would reiterate what Mr. Bodley had shared with the group. I think the Renew program has become pretty robust. in the last few years. And as he stated, the directors at the community colleges, I think, would all agree with that. If you look at the totality of the number of students in Renew plus the number of students that we have at the university, we have pretty strong numbers overall. I don't disagree with the interest in trying to expand nursing programs, but we are limited by one really critical element, and that is where we can place students clinically once they are in their program. We have a really limited number of placements for them, which is what's, I think, at least from the university standpoint, holding us back in terms of keeping the number of bachelor degree students to a lower number, because and now with Renew, and this is a good problem to have, but you have community colleges out in the various cities around the state. If you get too many students, then you start competing with each other for clinical placements. And if you try to go south of the border, then you start competing with University of Northern Colorado and the Denver colleges and so on. So we do have some limitations in that regard in terms of being able to place students in clinical settings. And I think that's not a minor issue for us or for the Renew program in terms of how much we could expand in terms of numbers.
All right. Does anybody have any questions or comments? Go ahead, Senator Rothfuss.
Thank you. And thanks to all three of you for being here. This is, I've had a lot of students that have been going through the nursing program, and they've been some of my best students. I know we're attracting some incredible people to this program. I'm a little bit curious though, kind of how it's working with numbers. How many students are starting at the colleges and coming to the university versus starting at the university and going through the program all along the way? I'll start with that question. Do we have a sense of that and what the distribution looks like?
Who would like to take that? Go ahead, Ben.
Thank you, Chairman. I just ran the numbers at all of the colleges for our nursing program. And just for the ADN program, which is primarily associated with Renew, these are students that will end up with an associate's degree of nursing. They will be registered nurses, and then they can continue to the BSN at UW. Most of our colleges are maxed out typically from year to year. In the 2018-2019 school year, the most recent one for which we have complete numbers, we had 44 students graduate at Casper, 35 at Central, 77 at LCCC, 30 at Northwest, 60 at Northern, and 38 at Western. I think David Bodley mentioned that the numbers can vary from term to term. The number of seats is largely based on, one of the things is the number of instructors that we have, and another aspect is the number of clinical placements for students to get through there. I did not mention Eastern because, as I think Dr. Caldwell mentioned earlier, Eastern has only recently started a program there, but we expect that they will be maxed out as well. Those numbers tend to be very similar from year to year. And again, the 2019-2020 school year, obviously our numbers are still coming in because of the face-to-face requirements of a nursing degree. COVID-19 has created some delays there. So I hope that's helpful. I can provide more information if anyone would like it.
Yeah, follow up, Mr. Chairman. Actually, if you could send that to us and any other data you have just in an email, that would be great. I'd kind of like to look at those numbers. But so of those, all of those were graduates with associates. Is that accurate? Did I understand that correctly?
That is correct.
And how many of those, and maybe this is a question for David, but it sounds like you're all tracking, how many of those ended up at UW coming for the rest of a 4-year program?
My best description is the number. This is a difficult thing to track.
Yeah.
And the reason that it's difficult for us and serves people who typically are in the workforce. It does serve students concurrently, also serve students, or we also serve registered in the workforce. We have deliberately created as flexible a program as possible. Start, take classes that are relevant to their practice, take a semester off and come back. But the way I typically idea that we have almost 300 in the pipeline. We only recently, in the last 2 years, got our program to speed and started at fully admitting. We about 300 in the pipeline, and when that's completely full, we would anticipate graduating almost that many or half that many. And given that the number of seats available at the is about 300, between 350 and 400. My best estimate is that we probably have of the ADN graduates are going to pursue. Issues we have is we're not the only game in town. There are other options out there. And so we've had to strive as flexible and as usable as we could to this answer.
Mr. Chairman, another question. Do you feel like demand is being met? I mean, do we have enough seats for those students that are qualified to be in the program, that want to be in the program, or are we turning people down that we would otherwise like to be able to say yes to?
Go ahead, David.
Associate degree programs are limited in the number of accommodate. The completion program, where renew students finish, can scale as needed. And so the pre-licensure programs are bound by total numbers, and those described by others to do with faculty capacity, clinical site placement. I will to you again, because I'm interested in raising awareness for Renew, that Renew takes a different curricular approach, and curricular approach to maximize those clinical sites best we possibly. So the seats, but those seats are limited by.
Did you get that, Senator Rothfuss?
Sort of, but it looks like Ms. Caldwell or Dr. Caldwell would like to respond.
Go ahead, Sandy. Dr. Caldwell.
Mr. Chairman and Senator Rothfuss, just to add on to that, in terms of the associate degree, yes, there is definitely a need for additional nurses. I want to be very clear on that. It takes quite a lot for that to happen. It takes the WIN faculty funding to make that work. It takes the planning for the clinical sites, but it also takes the appropriate facilities to make that happen. And so I want to be very clear, when you look at the data from the Board of Nursing, clearly there is a need for increased number of nurses. And I think the greatest capacity is at the associate degree level, because that is what feeds into clearly into the review program. So I just wanted to mention that, because that's where the greatest capacity is to impact RNs, both at the workforce level, but also to make sure that there's a good, strong pipeline for the bachelor's degree.
Mr. Chairman, one more follow-up on that with Dr. Caldwell. Do we have a sense of how many? I mean, if we were waving a magic wand, we're meeting demand now, we have it all in the right places, we're just doing everything that we would be doing, what does that look like, so that we have a sense of where we are versus where we would ideally like to be? And if you don't have those numbers off the top of your head, I'm certainly happy to read a one-pager later or something to better understand that.
Dr. Caldwell?
Mr. Chairman, Senator Rothfuss, we can get that for you. I don't have that exact number right in front of me, but I will tell you, we clearly have expansion plans right now in front of us with the Central Wyoming, the Western Wyoming, but I'm right off the top of my head, I know at least 5 of the 7 the colleges indicated, yes, we would move forward with additional nurses, nursing students and programs, but it is a matter of being able to scale it, the when, and the planning for the clinical and the facilities to do so.
Understood. Thank you.
Ben, do you have more to add?
I did have just a little bit more. When we reached out to the colleges, as Dr. Caldwell said, at least 5 of the 7 said that they have waiting lists for the nursing program. The primary restriction was nursing faculty, because you do need to have a relatively low number of students per nursing faculty because of the nature of the discipline. And then also, there is capacity for increasing the number of clinicals if we were able to increase the number of students coming through. And one of the reasons for that is to go back to David Bodley's comments, the close alignment across the state and the unique aspect of Wyoming's Renew program allows for very careful and efficient use of clinical spaces across the state. And by applying some dual shift clinicals and things like that, several of the colleges were confident that if capacity was increased, that they could find more of those clinicals.
Okay, so we'll take Senator Landon's question and then Representative Freeman after that.
Well, thank you, Mr. Chairman. And Ben, I really appreciate it. That answered one of my questions, which was, how do we overcome the limits on clinical space? Because that's really what has held us back for many, many years. My question to Dr. Caldwell would be, you've referred a couple or 3 or 4 times to the WIN funding. Is that because it is more of a case of creating new nursing faculty, or do you mean that in a broad scope that WIN is what funds healthcare programs? Because in our minds as a committee, I'm sure we're just thinking, well, what if we just give a little more money to the block grant so that we can create more of these healthcare programs or graduate more students? So can you help me with what specifically is it with the WIN program that makes that important?
All right, who wants to take that? Sandy, Dr. Caldwell?
Yes, sir, Mr. Chairman and Senator Landon, the WIN faculty funding is within the statutes. That is what funds the faculty at the community colleges so that they can add a nursing program. And how it works right now is that the college has to stand up that program. Once it's in place, then they request the funding. So they do have to add it right off the bat, off their own dime. However, then the funding comes forward to fund the faculty members at the community colleges. So it's a very specific funding for the associate degree nursing. It does not fund other healthcare programs. And I will tell you that there are health programs that the colleges are very interested in either expanding or adding, but it's certainly the startup cost for sure. So facilities, but the faculty, the equipment that it takes to do that. So the WIN funding does not cover other health programs. It is exclusive to the faculty for the associate degree nursing and students in those programs or for the advanced nursing programs at the university.
Thank you. Go ahead, Senator Landon, follow up.
Thank you. Just a quick follow-up. So Sandy, what you're saying is that the WIN program does fund all of the associate degree nursing programs out across the state. No other funding helps with that particular. I guess I didn't realize that WIN funded all of the associate degree nursing programs.
Go ahead, Sandy. I'm Senator, Dr. Caldwell.
Mr. Chairman and Senator Landon, actually, it doesn't cover all of the faculty. As they go to add faculty, they do request that. But there are actually several nursing faculty that the colleges are funding out of their general fund dollars. So it is actually a combination. And they are so limited that they're not going to be able to do that until they have that additional. And in this past session, that faculty was not fully funded.
Thank
All
you.
right.
Appreciate that.
Representative Freeman.
Thank you.
Go ahead, Representative Freeman.
Thank you, Mr. Chairman. And let me add a little anecdotal and experience as being a former board member at Western. One, besides the clinical space and the faculty are very difficult to find. A lot of times we had to go out and recruit people that we knew that would be great teachers and get them to have a master's degree so that they could teach for us. One of the requirements of one of the accreditation bodies that we have with nursing is that there has to be an 8-to-1 ratio of students to faculty. So if I'm a history professor, I can have 30 people that are that I'm responsible for. If I'm a nursing instructor, I can only have 8. And then when you add the cost of the labs and everything else that you need, it becomes a very expensive program. I remember being flabbergasted at the sims, the simulated patients that they use to help with the clinicals. How much they cost was very, very high. And going into more of an anecdotal thing is most, if not all, most of Western's nursing students are non-traditional students. They're usually 24, 25, 26. They oftentimes have a family, they have a job, and I'm an advisor to that club. And there's usually 3 to 4 to 5 nursing students in there or wanting to be nursing students. And I would sure hate to be a deer in the headlights with those people going, because they are driven students. They really want to get those things done. My office is also next to one of the nursing faculties, and I get to overhear a lot of conversations, and students come in and say hello. But almost to a person, I can't think of anybody that graduates out of Western's program is not encouraged and is not planning on going to get to a 4-year degree, a BA degree. It's just ingrained in how they get approved into Western's program. They get into the Western's program. They know that the next step is to go get their BA, and they do everything that they can to prepare for it. So hopefully that's helpful. But I think the big thing is to remember the 8-to-1 faculty. That makes it a very expensive proposition. There are not very many people out of there with master's degrees in nursing, and that's what you need in order to qualify to teach. And frankly, Western has been growing its own faculty for decades. And I am sure that the other colleges are doing the same thing. In fact, I think Mr. Bodley is a graduate of Western Wyoming College nursing program. Thank you.
Thank you, Representative Freeman. Representative Connolly, you have a question?
Yeah, thank you, Mr. Chairman. And this is a question for both UW and the community colleges. You know, it seems to me that it is one of the priorities of the legislature to increase the capacity of our healthcare providers in the state, in particular bachelor's level nurses, and that we're responsible for funding, honestly. And funding through WIND, funding through the block grants to both the community colleges and UW. And so we're in a period of constrained resources. And so I am curious about the level of kind of cooperation and collaboration between the community colleges and the university in terms of meeting that higher level goal. right? We know that the bachelor's programs, they came up, it was contentious 2 years ago. That's over and done with, but this is a priority, and that, and my interest is in making sure that the resources that we put out for you to do that really important work are being used in the best possible way. So again, I want to know about kind of collaboration versus kind of competition between entities, so that we're assured that the resources are being used well.
Go ahead, Dr. Caldwell.
Mr. Chairman, Representative Connolly, I will start on this, and then I think it would be best to then defer to Mr. Bodley. I will tell you that this is one of the programs, when I brought this inquiry up, it was very clear of the robustness in the amount of coordination and collaboration that happens through the Renew program. So I want to be very clear about that. In terms of how on the community colleges side of that, it was very much about the associate degree nursing, because that is the primary feeder and pipeline in terms of the capacity, and the interest very much was on the WIN faculty funding and the facilities around that. I got very clearly that this is something that is a model, and I will be honest, it is what we used to help create the structure for the CTE teacher prep plan that it just was approved at the university. Was why can't we do this like the Renew model and create a structure? So I will tell you that the interest of the community colleges around the bachelor's degree wasn't focused in the feedback that we got so much on nursing, because the clinical and how that functions with the university. Now they are focused on things like their bachelor's of applied science and health management, for example. That would be the area that they're focused on, the bachelor's level that can serve the administrative needs of the hospitals versus and the medical facilities, versus the nursing that seems to have this very efficient process through the Renew program. And with that, I would ask that Mr. Bodley be able to address that, because he works very directly with all those nursing directors.
Go ahead, David Bodley.
Thank you, Mr. Chairman. Representative Connolly, we do have a mission-driven organization around this very issue. The Renew program is mission-driven and has external governance that allows us to agree on curriculum, agree on before utilization of clinical sites. Because of our profession and because of this unique situation where both associate degree and baccalaureate degree programs prepare nurses for licensure, for practice, because of those things, we're afforded, and of our profession, we're afforded a level of collaboration that may not exist for other specialties. But we do hold ourselves as a model in this very regard, a model of collaboration for academic progression. This is that came nationally that we rose to answer, better prepare nurses through a seamless path from an associate degree to a baccalaureate degree. And has been alluded to earlier, this is critical to care in Wyoming because it's a baccalaureate degree that opens a greater degree that allows us to fulfill our faculty needs and practice nursing, which can help answer the primary care needs. So I can say that I did deliberately ask directors of the nursing programs at the community colleges if I could speak on their behalf for Renew. And I am an employee of the University of Wyoming, but again, I'm here more to Renew the collaborative than I am the University of Wyoming. So of this kind of collaboration, and I think as Dr. Caldwell mentioned, we do hold ourselves up as a model of collaboration versus mission. And again, were other programs to be pursued by the community colleges in this regard, we would embrace them and we would recruit them to be part of this collaborative. So I hope that answers the question, at least for nursing, in terms of collaboration.
Dean Jones, you'd like to add on?
Yeah, please. Thank you, Mr. Chairman. And again, speaking to the question from Representative Connolly, first of all, I would argue that the Renew program may be an example of perhaps the most efficient use of resources within the state. It is, as Mr. Bodley had spoke to, it is a pretty strong, robust collaborative effort that has been quite successful and continues to grow in the way that we want it to. I would add that speaking to Representative Freeman's comment about getting instructors, the nursing program at the UW has a master's degree program in nurse education. And the primary reason we have that is to produce master's level instructors who can hopefully go back to the community colleges to serve as instructors. Now, I don't have numbers as to how many who are in that program end up in the community colleges, but that's what we're trying to do with that program. And then just one other point, the broader picture about healthcare providers, healthcare professions. Obviously, there's a great demand across the state for all of the areas that we have in the College of Health Sciences and across the country. Certainly, we're trying to meet that demand, but at the same time, I think we are hampered a little bit, just as in nursing, with all of our other programs in terms of places to put the students for their clinical externships and their clinical placements. The demand is there for sure, but that is, I would say, a significant limitation for pretty much all of our programs.
Thank you. Representative Brown, you had a question?
Thank you, Mr. Chairman. So I can tell you just from personal experience here, I'm engaged to a recent graduate of the master's program in nursing education. And what I'll tell you is the graduating group this past winter was pretty small, but one of the things that I've seen concerning, not necessarily to do with UW, but kind of the community college portion of things is the salaries that are commensurate with teaching nursing to these students coming in is far less than what would be if I went to the local hospital and worked as a nurse. And so I think that we're going to run into a little bit of an issue where we have these nursing educators that really love their job and have paid the extra money to go on and go do this. And actually it is at UW as well. She recently applied for a job at UW and the starting wages were about $10,000 less than what she's making as a school nurse here in Cheyenne. So I guess my concern here is that if we put a lot of money, time, and effort into getting BAS degrees and getting these master's degrees teachers to teach in these community colleges, we're not going to actually get them recruited to teaching at the community colleges because they can make more money doing their nursing profiles. So maybe Dr. Caldwell and or anybody else can say something about this, but is there any discussion around what type of funding there's going to be when it comes to paying these nursing educators in these opportunities to make sure that they stay in these positions? Because to me right now, it seems like it would be a smarter idea for them to just go to the hospital or go to a clinic and work as a nurse.
Dr. Caldwell, do you have a comment?
Mr. Chairman, Representative Brown, yes, I will tell you that there are, specific to the nurse educator seeking a position, there are 5 pursuing advanced degrees right now and 2 applications that are in the works for the fall of 2020 for that specific purpose. However, there has to be an opening that gets into the 8-to-1 that Representative Freeman talked about, and the ability to expand a program and add a faculty member. Then when it comes to the salary, I'm going to just be really honest. You're you're accurate on that. We provided information to Joint Appropriations in January following our hearing about the low wages of the faculty in general for the community colleges. But in particular, we did talk about the nursing faculty. But again, that's tied to that WIN faculty funding that we provide the funding for the community colleges for the expansion of the nursing and then their own faculty policies. But when that's being funded through the WIN, there's still that limiting reality around those salaries. But I'm just going to be honest, the colleges and I believe for university, I think David Bodley is probably the best person to answer this question because he's worn all of those hats. Is that they really try to leverage the benefits of being faculty and what they're able to accomplish by really getting very high quality nurses out into the workforce, and in many ways in quite an altruistic way because the salaries are low. I'm just going to be honest.
Go ahead, Dean Jones.
Yeah, thank you, Mr. Chairman. Representative Brown, I don't disagree with your assessment by any means. We have certainly at the university, I can't speak to the community colleges. I'm not sure what their salary structure is by any means, but we've certainly worked to try to increase the salary structure for our tenure track faculty in nursing. There's always an issue, and this is not unique to nursing. This is kind of an academics versus industry type of comparison. You know, we have people in the College of Engineering that could go into industry and make a lot more than they're making as a faculty member. So in some ways, maybe it's apples and oranges comparison. Now, I'm not opposed to increasing their salaries by any means, but I think that's traditionally been an issue, the academic setting versus what I would say, you know, industry. We're always sort of battling that. We're trying to get closer to what hospitals might pay nurses. You know, we're not there yet, but that's kind of a constant battle.
Mr. Chairman, just a quick follow-up on that, if I could.
Yes, sir. Go ahead.
So, Dr. Jones, I guess what you just said is exactly it. And I recognize what you're saying about the importance or the difference. I'm sorry, not the importance, but the difference of looking at tenure track and academics versus practicum. That makes total sense. And I respect that. What I'm concerned about, though, is we have witnessed and have been witnessing nationwide a shortage of nurses for a very long time. And so is this maybe a time for your group as well as the community colleges to look at this and say, maybe not every nursing educator wants to come in and get their PhD and become a teaching professor for the rest of their life. They just like to transfer the knowledge that they have and get some of their students out into the practical world. That maybe we have, you know, master MSN nurses that want to teach and get paid a little bit more, but don't necessarily have the tenure track on mind. They don't want to become professors. They still want to teach and they still might go PRN somewhere. So is that a discussion you guys have had?
Go ahead, Dean Jones.
Thank you, Mr. Chairman. Representative Brown, I don't know that we've had in-depth discussions about that, but I will say we do have a new position that was just created that might be a model for what we want to look at for the rest of the state. We have a position, a nursing position that is funded 50% by College of Health Sciences and 50% by, I think, a foundation at Cheyenne Regional Medical Center. So that person is going to be at CRMC practicing as a nurse, who will be taking students to educate students and focusing up to a great extent on evidence-based practice and things like that. That way, I mean, they are in the hospital setting, and I know what the salary is. I'm not sure how that compares to other nursing salaries at CRMC. I would bet it's pretty competitive. that might be something we want to look at for the rest of the state, where we're placing them out there. Their home is in the hospital, and but they also have an obligation to the university to help train nurses.
I like that. Thank you.
Further questions? Representative Simpson.
Thank you, Mr. Chairman. I'm trying to put my arms around the actual total in the state of Wyoming of students we're putting out on the street. I thought I had it, but then we started talking about in pipeline and I got thrown off. So Mr. Morowitz and Dean Jones, what is your totals? In 19, how many graduates did you put out on the street of nurses?
Go ahead, Dean Jones.
Mr. Chair, Representative Simpson, over the last 2 years, the School of Nursing, the average number of graduates was about 150. Now, that is a compilation of several of the programs, the bachelor's programs that we offer. The basic bachelor's degree in nursing that we have on campus, where they come in here, they start as a freshman and they go all the way for 4 years. We also have what's called the BRAND program, the Accelerated Nursing Program. And these are individuals who already have a bachelor's degree in some other area, but are interested in nursing. And it is a 15-month intensive curriculum where at the end of 15 months, they will also have a bachelor's degree in nursing. So it's highly clinical because they have a lot of the basic foundational knowledge through their other bachelor's degree. We usually have about 25-ish students who are in the BRAND, the Accelerated Nursing Program. Then we also have the RN to BSN completion program, and that is an online program. And we have a lot of numbers in that program. The issue is it's online, and so there are students in that program who are not in Wyoming. So they can be anywhere in the country taking that program. So I don't have the numbers in front of me, but I could probably get the numbers in terms of how many students that are in Wyoming that we are graduating who are in Wyoming or from Colorado or whatever. They're in the neighborhood, not from, in New York City taking, the BSN online. How many of those we are putting out that would be available to be working in the state of Wyoming? Because I think that's actually a number I've been trying to get my arms wrapped around as well, and I'm not sure we have that readily available. But because that's one issue. How many are we putting out that could be working in the state? And then I think the other issue is how successful are the communities able to recruit nurses to stay and to work in those communities when they graduate. And again, I don't have a sense of that either. So.
Go ahead, Ben.
Thank you, Mr. Chairman. The numbers for the 2019 graduating class in the 7 colleges were 284, and that's ADNs, registered nurses. Then there were also 155 licensed practical nurses and 67 CNAs, certified nurse assistants. And we don't have an exact percentage of the number of graduates that are practicing then in the state for that particular year, but we have run some numbers in previous years, and typically those numbers are 80% or higher. The students that come from the community colleges have a high likelihood of staying in the state.
Okay, Senator Landon, go ahead.
Thank you, Mr. Chairman. Not to draw out too far here, but real quickly for Ben or maybe Dr. Caldwell, what has been the impact, if any, the closing of the Riverton Hospital on the Central Wyoming program, or has it had no impact?
Go ahead, Ben. Oh, okay, Dr. Caldwell.
Mr. Chairman, 2 things, if I may, and I believe that Senator Landon, on the prior discussion that we just had about total numbers, the Board of Nursing actually has that information. and I think could provide the answer to that. And then to answer that second question, I would need to find out the answer to that. I know that they're actually looking to expand. Of course, that's in the Jackson facility through Central Wyoming College, but we could get that information for you to find out what impact it has had. What I do know is that they are still moving forward with the full class.
Thank you, Dr. Caldwell. And Mr. Chairman, we'll take up the issue of rural hospitals next week on our corporations committee. And so I just had a curiosity there. And if I might, Mr. Chairman, I wanted to thank the Dean for, Dean Jones, thank you for bringing up the information on the BRAND program. I was going to ask about that. Having been one of the prime sponsors of that legislation creating the program, I'm happy to hear that you've got up to 25 students involved there. I think conceptually, I always really liked that idea and appreciate that information and hope that it's producing some more nurses for us. Thank you, Mr. Chairman.
Thank you. Anybody else? Okay. Oh, yes. Go ahead, Senator Ellis.
Thank you, Mr. Chairman. I was listening and I was looking through the materials, and I don't know if it was covered. I know we kind of generally always have a nurse shortage and always want to get more people in that pipeline for careers. But can you just talk a little bit about stepping back about COVID, whether or not just kind of what strains or maybe not strains we've seen on hospitals? I'm just kind of curious what it's like for nurses, if they've been having to work more or what's kind of going on, because visiting with folks at my hospital. Yikes. I gotta go. Someone's on my other phone.
Who would like to take that on? Anybody? Go ahead, David Bodley.
Thank you, Mr. Chairman. Senator Ellis, I can say that because the demographic we serve are often practicing nurses. And so I can tell you anecdotally that we have had nurses in our state who have contracted the virus and thereby been removed from the workforce, which causes a double, because now someone has to cover for them and there's virus in their workplace. We have had clinical sites, and this is across the country, clinical sites have in response to the virus have closed clinical placements for students. So I speak with pride about our profession and about nursing education at the kinds of adjustments that we have had to make with factoring accrediting bodies, factoring the Wyoming State Board of Nursing, factoring students at various places in their clinical education and in their education overall. The response of the nursing profession has been as depicted in national media. Nurse, just like any other service provider, step forward into these versus retreating from these problems. But specific to nursing education, we be as versatile, as flexible, as creative as any education institution. Plus, that's exacerbated by the fact that clinical sites pushed clinical sites to students. So we have been affected in our state very directly. We've been affected indirectly, and the nursing community and the nursing educators challenge.
All righty, go ahead, Representative Simpson.
A little different perspective from the smaller areas. This, an example in my area, Star Valley Medical Center, they employ 360 employees. They have 3 surgical suites. And in April, they furloughed 70 employees, including many nurses, because of the surgical suites being offline. They've since gone back to surgeries and recalled all their employees, but they're currently fully staffed. They don't have any nursing shortages, but they did not have any COVID-19 patients that ever entered their hospital at all during the whole time. And so I think many of our smaller hospitals have been more in that situation where really the nurses have been in excess because of the lack of other patients. Thanks.
Okay. Dr. Dean Jones, go ahead. And then we're going to move on to public comment.
Thank you, Mr. Chair. I just wanted to add, in case anyone on the committee was wondering, how has this affected student training? Because as Mr. Bodley mentioned, most, if not all, clinical facilities, hospitals, outpatient clinics, basically restricted access to health providers, healthcare students. Fortunately, this occurred far enough into the semester that pretty much all of our students had obtained the minimum number of clinical contact hours required by the accrediting body for graduation. So plus that, and crediting the division heads and the deans in my college, who worked very hard to make sure we could come up with alternative methods of clinical training for our students. This has not delayed the graduation for any of our students in health sciences, probably with maybe the exception of our dental hygiene students. But all of our other students, almost 100% of them will still be able to graduate on time when they should have, either this in May or in the summer when they were supposed to.
Thank you. Okay, so I showed two people wanting to talk on public comment on this subject, Stephanie Hickswaw from Northwest College and Kathy Wells from CWC. Karen, are they keyed up? Ready to go?
Yes, I brought them both into the room just now.
All righty, so Stephanie Hickswaw, please go first. Stephanie, are you ready? Getting close, huh? You're muted.
Can you hear me?
There you go. We got you.
There we go. Sorry about that. Thank you, Mr. Chair. My name is Stephanie Hickswaw. I am the president of Northwest College. I just wanted to respond a little bit to some of the conversation you had regarding the WIN funding. I just wanted to clarify, when Dr. Caldwell says that wasn't fully funded, it was not only not fully funded for all the nursing faculty that we have on our campuses, it wasn't fully funded for the current WIN funded faculty. So for example, when Senator Landon asked how many we have, Northwest College has 5 nursing faculty. 2 of those faculty are currently funded by WIN funds. However, the legislature last year did not fully fund all of those current 2 positions. So I may be in the position to have to eliminate one of those WIN funded positions if that is not fully funded going forward due to budget cuts. So as we look at budget cuts, that's a tough balance to start thinking about how do we grow some programs and cut others with the decisions that we have to make on campus. So I just wanted to make you aware of that. But I did really like Senator Landon's idea of putting more funding into the block grant for healthcare programs. Certainly fully funding the WIN program would be huge, but also that additional funding for programs, then the colleges could use it as they need to. For example, I have worked on starting up a surgery tech program, and I can't afford to hire a faculty member. So we have accreditation, we're ready to go, we have clinicals. I'm just waiting to be able to free up some funds to be able to hire a full-time faculty member in that area. So that could give us some flexibility for the programming that we're already planning on. Starting up a brand new program, depending on what it would be, could cost anywhere from $500,000 to $100,000. We also have to think about procurement of equipment and the length of time that takes. But also, it's important that for healthcare programs that Separate accreditation extends the time to start up a program. So for a medical lab tech program, for example, that takes about a year to get one of those up and going. But a surgery tech or a respiratory tech or a sonography tech program, that's closer to a 36-month startup, even if we're hurrying and working very quickly. I also wanted to let you know, Senator Rothfuss, that we have a wait list of about 100 people to get into our nursing program currently. We accept 25 every year. So part of our expanding of our healthcare programs is to take those students who have been taking healthcare prerequisites and give them some other options. An idea that the community college presidents had in order to expand healthcare and other programming for that matter is to be able to expand some of our online offerings right now and reach out into communities where people are home with their children to teach them at home or not able to travel, and especially during the COVID situation, but just overall in general, is to be able to offer more of those prerequisites, biology, mathematics, online. However, the way that House Bill 80 works with our current funding formula is that online classes are only paid at 80% of what a regular face-to-face class would be. And so we are struggling financially to be able to do some of that kind of expansion because we're not reimbursed at that same level. The other thing I wanted to let you know that may be helpful to consider is that with people who may be interested in going into healthcare programs, if they are unemployed at this time, it's a good time to go to school. It's a good time to consider going to college. However, because as Representative Freeman said, they are usually older and have children and other responsibilities, their financial situation right now is such that they can't even consider college as an option. In the Wyoming Tomorrow Task Force, of which Speaker Harshman is the co-chair, we've talked a lot about the idea of an adult promise program that may give an opportunity for free tuition for people coming in who might be interested in getting an education. I think that could be a really nice solution for use of some of these COVID funds right now, to be able to give students the opportunity to get into the programs that we have, or perhaps can expand as we work through some of these thoughts and ideas. So thank you very much, Mr. Chair, members of the committee.
Thank you, President Hickswaw. Representative Connolly, you have a question?
Yep, thank you, Mr. Chairman. And President Hickswaw, it's nice to see you. And I'm curious if you visited at all with the governor's office about the availability of any of the CARES money for funding for nurses or the nursing educators that weren't funded in the budget. Now, I mean, CARES money can't be used to backfill, but if it wasn't budgeted, then it seems to me that the community colleges, in particular your program, would be kind of right for some of that money that is being directed in that first tranche for kind of direct response. Just a thought for you.
Go ahead, President Hickswaw.
Mr. Chair, members of the committee, Representative Conley, that would be a question specifically for Sandy Caldwell. We have not had that conversation, but she is in conversations where they're brainstorming. That specifically was not included in our initial $53 million request. That request for COVID dollars was more for immediate response to cover the costs for cleaning, for personal protective equipment, and other of the massive startup costs that we're facing.
Dr. Caldwell, do you have anything you'd like to add?
Mr. Chairman, yes, and Representative Connolly, that specific request was not added. We could always go back and submit that specific amount. The challenge with that is that we did request that in the session, during the budget session. It just wasn't funded. That creates quite a challenge for us to make that request and substantiate that it is a response to COVID-19 versus just a deficit funding. So we can put that in, however, and we could absolutely try that, but based on the U.S. Treasury guidance, we did put that request in the budget session. It just wasn't funded.
Do your best.
All right. Any other comments or questions? Go ahead, Representative Peperinen.
Thank you, Mr. Chairman. To Dr. Caldwell. How much does the healthcare industry, private sector, contribute through partnerships to the nursing education to provide the need of their nursing employees in healthcare? I see this, I'm hearing that we're not providing enough at the legislative level, but I'm just curious, how much is the private sector stepping up?
Dr. Caldwell.
Mr. Chairman, Representative Peperinen, a lot. I'm not sure I'm able to quantify that right now, but I will tell you the clinical sites are absolutely dependent on the partners, the hospitals, the medical facilities. They participate a lot in this. They provide equipment to the institutions, and they help them stand these programs up. I do notice that Dr. Wells is on. She might be much better prepared to answer this question than me. And also Dr. Hickswa, how each of the 7 colleges approach that it varies, but I will tell you there's a lot of support. They could not do the clinical sites without the significant support of the medical facilities in their regions.
Dr. Hickswa, do you have anything to add?
Certainly. Thank you, Mr. Chair, members of the committee. And as Dr. Caldwell said, Dr. Wells, who is on, is the Vice President of Academics at CWC. And so she specifically does these partnerships. But let me give you an example of the surgery tech program that we are working on at Northwest College. We do not have the facilities on our campus to be able to offer a surgery tech program, but the Powell Hospital is allowing us one of their operating rooms to be able to use as a classroom, and they are scheduling their surgeries around it because there is such a need for surgery technicians in our area. And there's lots of those kind of examples throughout the state. You heard Dr. Caldwell speak earlier about clinical site rotations and doing double duty. So their hospitals are allowing us to do night shifts. We work in partnership with larger hospitals in Casper. It's just amazing the outpouring of support from those partners. Part of it is because they certainly support what we do, but the other part of it is they desperately need those employees. And so they're working creatively as we are to figure out a way to make it happen.
All right, let's go to Kathy Wells and hear your public comment.
So thank you, Chairman Cole, Northrop, senators and representatives. If I could add a little bit to the question that some of the others on the call just addressed, and I'll get to my public comment. I have previously served in the role at CWC as a director of the nursing program, and prior to that, nursing faculty was instrumental in leading the group that designed the Renew curriculum and implementing that. So even though I'm not in that position now, I still remain very close in advisory roles. Regarding clinical and healthcare facilities support of nursing and other healthcare programs, the examples that those have shared in their responses are quite accurate from the perspectives of all the programs and across all the colleges. Dean Jones mentioned a collaborative project that he has going with CRMC and an employee sharing opportunity. Many of the nursing programs have done that with their faculty as well. For example, when I was the director of nursing at CWC, we had direct financial support from St. John's Medical Center in Jackson in support of additional pay for our nursing faculty that were located on ground in Jackson. They provided an additional stipend to help bridge the challenging cost of living in that area. That facility also provided a classroom for us. We don't have our own building in Jackson, and they provided educational space for us to use. Without those kind of partnerships, we couldn't offer these programs. Specifically right now, LifePoint Hospitals, which is the corporation that runs both the Lander and the Riverton Hospital, currently offer facilities for instruction. They share employees and help support some employee costs, certainly have donated equipment and time of their professionals for some specialized guest instruction. But they also have recently started a scholarship program through direct donations to the CWC Foundation, where they scholarship 2 to 3 nursing students a year to cover cost of nursing education. So those are just examples of the types of partnerships and contributions that healthcare facilities make. So if it's okay with the group, I'd like to start my public comments by sincerely expressing our appreciation to your service, to your state and the leadership that you're demonstrating during these challenging times. We certainly appreciate that and certainly acknowledge the work and the difficult decisions that you have before you. I have to say that I am honored to have the opportunity to work at CWC and assist students in meeting their education and career goals. Based on my past experience that I mentioned with my connection to the CWC nursing program and serving as their director for 8 years, I know how essential healthcare programs are and how essential skilled and competent professionals in the workforce are so critical to the overall health and safety of Wyomingites. We have identified that the current COVID-19 crisis certainly has made us all aware of the shortages, in particular for healthcare professionals across Wyoming. Yes, previous conversation has made note of furloughs because of the inability to perform elective procedures. That was a challenge. However, finding healthcare professionals to serve COVID patients, and as you know, Fremont County is the hotbed of COVID activity. My nursing students have taken care of COVID patients in both the Lander and the Riverton hospitals. That was a significant challenge. Those healthcare workers put in an extensive amount of overtime to meet the staffing needs when our healthcare facilities were challenged with providing care to those who needed it the most. CWC's Jackson campus will double the number of nursing students that we have capacity to enroll every year. Currently, our nursing program in Jackson admits 8 students. Our future building provides the capacity for us to admit 16 students annually, which will result in significantly higher numbers of nursing graduates entering the workforce each year. And as was mentioned earlier in this discussion, a very high percentage of those nurses that we educate in our Wyoming community colleges and the University of Wyoming programs stay in the state of Wyoming. The data on that from CWC for our Riverton nursing cohorts and our Jackson cohorts is 95% of those graduates take their first nursing position in Wyoming. So we are directly impacting the healthcare workforce in our state. Our CWC Jackson program is full with a very long wait list. I will add that our Riverton campus also has a very long wait list. And our students have a 100% pass rate on their nursing licensing exam and 100% employment rate upon graduation. Our future CWC Jackson building will also be able to provide several new healthcare certificates and degrees, such as patient care technician, medical assisting, certified nursing assistant 1 and 2, phlebotomy, and medical office support, all critical direct care and support professions that are in demand right now. For further details for this group on how CWC is advancing healthcare professions in Wyoming, I would encourage you to please take a moment to read the letter that was emailed to you this morning from CWC's president, Dr. Brad Tyndall. There's some additional detailed information that I won't share during my public comment this morning. As important as healthcare is, we know our economy throughout Wyoming also needs a significant boost. CWC's Jackson building and all the community colleges throughout Wyoming support our economy by providing those critical degrees, certificates, continuing education, workforce training to advance students' knowledge, skills, and the impact they can have on directly entering the workforce and boosting our economies in the jobs and fields that their economies need the most. Community colleges have always demonstrated the ability to be flexible and just to their service area's economic and job needs. We are one state, but we do not have the same economic and workforce needs in all of the community colleges' individual service areas, and we must be flexible and responsive to those needs. We know that CWC and our fellow Wyoming community colleges stand ready to assist the state in tackling the difficult challenges ahead. So specifically, our future CWC Jackson building will also serve Teton County's economy and economies of the surrounding region by tripling the culinary program enrollment. And we can all agree that food service and culinary professionals is a key component of our state's tourism industry. This new building could give us the opportunity to double our enrollments in our various business programs, including strengthening our partnership with our very successful Startup Intensive program through our partnership with Silicon Coular, which cultivates new Wyoming-grown small businesses. CWC has served Teton County for over 40 years. However, I'll be the first one to say we have not effectively served them because we have been forced to move from one temporary location to another temporary location. That is not how we need to serve our constituency. Our future Jackson building will help us to continue to provide that exceptional quality nursing, healthcare, and other critical certificates and programs that support Wyoming's overall health and economy. So thank you for letting me provide public comments on our plans for our future Jackson campus. CWC's Jackson building will provide a path to increase numbers of professional healthcare graduates and a more robust economy throughout Wyoming. So thank you for the time, and I'd be happy to answer any questions that you may have.
Thank you, Dr. Wells. Any questions or comments to Dr. Wells? All right. If there are none, then I'd like to ask Mr. Matt Wilmarth if he would look into seeing if we can get any of the CARES dollars into any of these programs, whether it be the Renew or REN.
Mr. Chairman, sure. We'll review the current U.S. Treasury guidance that has been issued, and I think Dr. Caldwell indicated some of that guidance is prohibited some of this ongoing funding, as it's not directly tied to the COVID-19 response. But we'll get back to the committee on what exactly that guidance is.
Thank you. Okay, committee, with that, I have 9:54. Oh, yes, Chairman Carver.
Yeah, thank you, Mr. Chairman. I guess I'd ask the members of Management Council what they expect from this committee on this particular item. Do they expect a letter of support? Do they expect us to come with a proposal, for instance, to increase funding? So I'd either ask Senator Landon, Senator Office, Senator Representative Connolly, who am I missing? Representative Freeman. What does Management Council expect from us?
Senator Office, go ahead.
Thank you, Mr. Chairman. We really are expecting potential legislation for the next next session, the special session, if there is anything on this topic that we should be taking action on. So that could be funding, if there is a direct path to expanding this that might use COVID funding. We had some conversation about possibilities there. It's not to say that this legislation would go forward and be prioritized necessarily, but if there is a clear path where action can be quickly taken that would be better taken now than through a general session. That's what management council is really looking for in these topics. And I'd yield to any of my colleagues to add anything else to that if they have any additions.
Go ahead, Senator Landon.
Mr. Chairman, thank you. And to Chairman Coe, Senator Rothfuss did a good job of kind of encapsulating what our visit was on management council. And I think hopefully none of our members would get the wrong idea from management council. It's been bandied about at other committee meetings that that this is a mandate that comes down from on high, and it really is not that. It is a suggestion by the management council to all of our committees that we take another look at several of these issues. This particular one, we really hit the nail on the head when we requested of Mr. Wilmarth that let's take another look and see if we can turn over a couple more rocks and maybe find something that that we could do at the end of June that might make a difference. And so, you know, I don't think it's a mandate that would come with legislation, but if there's something there, we knew that the Joint Education Committee would find it.
Senator Coe, Chairman Coe, does that answer the question for you? Good, good. All right. So I think, go ahead, Representative Connolly.
Thank you, Mr. Chairman. And to that end, I think I'd like to make a motion for a bill draft that would restore the funding for the WIN nursing program.
Looks like we have 2 seconds. So it's been moved and seconded that we have a bill draft for that would restore the WIN or RIN funding.
And Mr. Chairman.
Go ahead, Senator Rothfuss.
Thank you, Mr. Chairman. I think we can do that with COVID funds, and I'd ask if anybody sees otherwise. I mean, my understanding of the obligations that we have on the way to spend COVID funds would allow for us to do that. But we do have to expend those funds by December 31st of this year, realistically. So it'll be interesting to see how we would do that. I'd ask Matt Wilmarth if he has any ideas on how we could encapsulate Minority Leader Connolly's motion using COVID funds as an augmentation, since it's not a supplantation as I see it.
Go ahead, Matt.
Yeah, Mr. Chairman and Senator Office and Senator or Representative Connolly, again, well, I think we'll have to evaluate what the guidance is from the U.S. Treasury on the applicable uses of those funds are. And we can certainly evaluate that as we draft the bill. And just so the committee knows, the first bill that was provided or authorized in the first special session has 3 tranches of this CARES Act funding. The first $400 million was authorized upon enactment of the bill. The second $400 million is authorized July 15th of this year, unless any subsequent legislation modifies it. So the timing of this second special session depends on when that second $400 million moves on without any further legislative guidance. So that's part of the reason the Management Council requested these topics to be discussed at this meeting, is to try to get some direction before that July 15th date, if we can stand up or use some of these funds for that purpose. So short story, we'll get back to you on explicitly what limitations are on that funding, if it can be used for this purpose.
Thank you. Representative Brown, do you have a question?
Just a couple statements, Mr. Chairman. First and foremost, if we are drafting a bill for consideration for this committee to look at to restore this funding for the next special session, are we planning on meeting prior to that special session for this committee to reconsider that? I see Representative Connolly's raising her hand to maybe to bring some light to that. So that's number one. Number two, I'm not personally a big fan of trying to use the COVID money for this, and there's a couple of reasons why. The first one is I do think that it's beneficial up front, but what it does is it sets the expectation in the future that we have to find somewhere to fund this elsewhere. You know, I don't want to put something up there on the board for a short time use that we can expend these funds and have it up and running, and we get it going, and then all of a sudden the bottom falls out. We're in a budgetary crisis right now. We do not have the capability of standing up new programs and doing new things. We're in a position where the governor sent out a letter yesterday asking state agencies to cut 20%. And here we are looking at adding something. So I think it's the wrong message to send. I think it's the wrong idea at this point in time. I understand the gravity of the situation and the idea that we need to do this. But I really, really question whether or not this is a want versus a need. And I'm strongly in opposition to the idea of moving forward with this. I think this is a great idea, but this is one of those situations where I'm just not certain that this is the point in the time for us to be doing this. So, Mr. Chairman, with that, I'll just voice my opposition on this.
Very good. Representative Connolly had her hand up first.
Thank you, Mr. Chairman. And to go to the 2 points of Representative Brown, and actually following up on the good Senators Rothfuss and Landon about the Management Council directive, it was the assumption of Management Council that committees would be meeting, having these discussions, and have bills where there could be votes on the bills that are done kind of remotely. You know, it is extraordinary that we do that, but we have done it before. And honestly, the motion is for a bill draft that is simple enough that we would not imagine amendment to it. And so that was kind of the thought behind Management Council as well, and that other committees would be operating like this with COVID-19 topics. So kind of that's the procedure that was anticipated. And correct me if I'm wrong, other members of Management Council. But the second element would be that in terms of the bill draft and where the money would come from, and of course people can vote it up or down, is I would hope for a kind of paragraph in the bill that would say something, you know, to the extent that CARES or COVID-19 money is available, it should be used first. But the second part of the bill would be to simply restore that money, because of the importance of this nursing education that's being done around the state. So that's some clarification. Thank you, Mr. Chairman.
Thank you. Senator Landon, you had a question?
Mr. Chairman, thank you. Representative Conley did a good job of explaining what I was going to also talk a little bit about, all of the expedited procedures that we're going to have to undertake over the next couple of months. But I want to come back to Representative Brown's comments, and I have to admit I have some of the same reservations. My biggest concern over directing funding specifically to a WIN program would be both in action and perception. I don't want it in any way to affect or override what might happen with budgets at our community colleges. For example, you know, I don't want someone to indicate, well, we just gave extra funding to the nursing programs of the colleges, so why would we consider holding budgets whole? You know, we're just in a really difficult financial time, Mr. Chairman, and so I'm just feeling a little bit cautious here. We're going to need a whole lot more help for our colleges than just restoring some WIN funding, which would restrict us to that singular program versus maybe a little help to a block grant that would enable, as the president from Northwest College indicated, might enable us to stand up a brand new situation that would really help our economy. So, you know, I'm trying to decide whether to at least support the bill draft so we can look at something, but those are my reservations. Thank you.
Thank you. Senator Rothfuss.
Well, thank you, Mr. Chairman. Yeah, we're definitely in an awkward time right now where we are trying to cut the budget by 20%. We clearly need new revenue. We have challenging circumstances. At the same time, we do have funding available, and we have a need to identify solutions that will allow us to sustain and move through this downturn to keep people employed. And we know that when people are unemployed and when people are struggling, that's actually the time that we want to have the availability of these education programs. So providing an opportunity to expand, as Dr. Caldwell was saying, and others, this is the time when you actually want some strength in education. You want some resources available. And if it is one time or short time, I still think that's advantageous, but maybe we can ask and see if the colleges would only want it on an ongoing basis, or if we had temporary funds, would it be beneficial, and could we end up training up more nurses, getting them into the job market, creating some jobs, and providing some stimulation with these funds, which is obviously one of the purposes of these funds. And I don't know if any of our folks here that have been providing testimony could give some thought. If we were still down the road going to have to trim the WIN budget again, if we couldn't come up with additional revenue to support the increased level, is it not worth the investment at this time, or would it still be of benefit to have a year of full funding, which might be the limit of it? I don't know if Dr. Caldwell wants to weigh in, or I see Senator Coe.
Go ahead, Chairman Coe.
Hey, Mr. Chairman, thank you. This brings up the discussion we had back around 2002 and 3, and I'll bet that Representative Freeman, and I don't know who else was there, on de-earmarking. And we went through de-earmarking. Now, with this particular program, I'm in support of the motion for one reason, and I respect Representative Brown's thoughts. We are not creating or funding a new program. The way I understand the motion is that we're supplementing an existing program in this crisis period that we find ourselves, and we'd always have the option out there in the future to cut this funding back. So I don't look at it as a new program. I look at it as a motion to supplement an existing program. Am I wrong with my thoughts there?
I don't think so.
I don't think so. I think that's the way I see it too. Dr. Caldwell, would you like to comment?
Mr. Chairman, yes, Senator Chairman Coe and Senator Rothfuss, this would not be for expanding. You are correct. This is for existing faculty. This is a shortfall in the biennial funding for existing faculty, and you heard Dr. Hickswa mention that this is paying for faculty who are already employed and under that statutory function of the WIN faculty funding for an 8-to-1. So this is a shortfall in the biennial budget for the existing faculty.
Mr. Chairman, can I follow up with a question on that? Where did Mr. Chairman go? There you are.
There you go.
Dr. Caldwell, on that point, I mean, can you tell us a little bit about it? If we were to fill the funding gap versus we're not to fill the funding gap, how would that affect the number of nursing graduates we would end up with? Can you just kind of give us a direct comparison of the cause effect there?
Go ahead, Dr. Caldwell.
Mr. Chairman and Senator Rothfuss, I would have to get the exact, but I believe that is about 2 faculty members with their benefits. So that would be 16 students.
Yeah, thank you, Dr. Caldwell. And if we end up moving forward with this motion, which I hope we will, to at least explore it, would you send us the information that kind of details that and how it would be used, what the value is, and everything else? I assume we'll see that.
Okay, Representative Brown, and then we're going to vote on the motion.
Yep, Mr. Chairman, I totally understand. I appreciate the sentiment here that we're looking at supplementing a shortfall. My heart bleeds for community colleges. If there's anybody that's pounded the ground for community colleges more than me, I'd like to see them. But I will say that we're going to be hearing this exact same discussion from every single state agency for the next amount of time. Everybody's going to be needing money for a program that needs to be set up or needs to be stood up. We're being asked for 20% cuts across the board for state agencies. And I understand that we're putting some money into this to supplement this, but we're eventually going to have a situation in which we as legislators make the hard decisions as to which programs to fund and which ones not to fund. And I understand Senator Office's emotions here and his sentiments on this is the time to do it. But in a cynical world, I guess, would say, when isn't the time to fund education? And I would say that that's probably the case, that most people say we always want to fund education. And I agree with that. But right now we are in dire straits with money. And I'm not so sure that we want to prop something up with COVID funds that we're going to have to yank out from underneath them in the future. So with that, Mr. Chairman, I'll shut my mouth.
Thank you. Senator Office.
Thanks, Mr. Chairman. Very briefly, I'll just weigh in and say we're also allowed to raise revenue. That's all.
All right, we're going to vote on the motion that's on the floor, and that was okay. Senator Hutchins, I see you. Go ahead, Senator.
Thank you, Mr. Chairman. I really appreciate it. I'm going to be a no on this motion, and I'm going to tell you why. The first bill we passed, SF 1001, it specifically says in the bill, like I said, I agree with Representative Brown, that currently the allowable expenditures for relief funds provided to the state under the CARES Act are restricted and may not be used to fill shortfalls in state and local government revenues. I'm just going to put that out there, let you vote how you want, but that's what the bill we passed says. So thank you, Mr. Chairman.
Senator Roth.
Thank you, Mr. Chairman. I'd like to address that. And that's something that if we do pass this motion, LSO staff and Mr. Wilmarth and others will look at. But the detail there is that we already passed a budget. That budget has a specific value of funding.
Yep.
We cannot supplant that budget, but we can augment from that budget. Yep, that's the advice that we've gotten as we've been working through this through Management Council, as we've talked to Mr. Richards and others. So the applicability of the funds specifically for this project is something that I think we need to look at. But the idea that we can't spend it because we already have a program just isn't accurate with the way the statute's written. You can certainly augment an existing program. There's no question about that. And the fact that we cut this before shows that it would be an augmentation. The only question then is whether this is an applicable use of the funds for the COVID funds, not whether it's supplanting versus augmenting. I think we're fully safe on supplant versus augment. I think we need exploration on specific use.
Thank you. Thank you. With that, we're going to move to voting on the motion as you have heard it. All those in favor signify by raising your hand. 1, 2, 3, 4, 5, 6. I have 6, 7. All those against it? 1, 2, 3, 4, 5, 6, 7. Really? 1, 2, 3, 4, 5, 6. 6. Is that what everybody sees? 6? All right, then the motion passed. With that, let's take a break. It's essentially 10:15. We'll be back here at 10:25. Thank you.
That was interesting.
Which part?
The whole thing. Yeah, that wind funding. No, you did a really good job though. Is everybody,
It was muted. It wasn't muted. I don't know what I said.
saying, you said it's really intense and goes 7-6. You said I would have broke the tie, but it wasn't a tie, so you're good.
Well, do we have a quorum? I don't think so either. There we go. There's another one. Now we're coming back. All right. So the next section we have is community Wi-Fi and telemedicine, teleeducation. And Stefan Johansson, Deputy Director of Policy and Education Administrator for the Wyoming Department of Health, is up first.
Thank you, Mr. Chairman and members of the committee. My name is Stefan Johansson. I'm the Deputy Director for the Wyoming Department of Health. Appreciate the opportunity to testify before you this morning on a topic that's getting a lot of attention, especially during the COVID-19 pandemic. I've been asked to talk a little bit about Wyoming Department of Health programming and funding for telehealth, telehealth services, telehealth programming, et cetera, especially as it relates to potentially using CARES Act dollars to support telehealth programming, specifically in schools. So, Mr. Chairman, if it's okay, I'm going to give you just a brief overview of the Department of Health's telehealth policy and programming, very, very short and sweet, and then discuss a little bit of what we have, and this will be a little bit of rehash for this committee in terms of the CARES Act guidance, what's in the US code, what's in the law, and maybe some problems with sustainability on funding for programs like this, specifically to CARES Act dollars, and then a few policy considerations for the committee. So very briefly, like I mentioned, in terms of Department of Health telehealth efforts, I see it really in two buckets, Mr. Chairman. One is on the policy side and one is on the programming side. Very briefly on the policy side, it's primarily related to Medicaid. Our Medicaid program ensures roughly 80,000 individuals across Wyoming with healthcare coverage on an annual basis. And when it comes to services for those Medicaid beneficiaries, Medicaid does reimburse for telehealth services that are received via telehealth. And in fact, a couple of years ago, we changed our rules and policy to pay for telehealth visits at parity with in-office visits, with a few exceptions and a few policy kinks there. But that's primarily the main policy area of telehealth for the Department of Health is really as a payer. And that's primarily through Medicaid that reimburses for telehealth services. The second area, like I mentioned, is programming, and this is a bit smaller, but I think what most folks are used to. And in terms of our telehealth program, it's really a combination of efforts in conjunction with the University of Wyoming through the Telehealth Consortium and the Wyoming Telehealth Network. Essentially, our programming for telehealth through Medicaid and through the Office of Rural Health supports those efforts for the Telehealth Consortium and the Telehealth Network with the university. Essentially, what that entity or that program is engaged in is really promotion of telehealth as a service delivery mechanism for healthcare throughout the state of Wyoming. So, for example, we offer through that program HIPAA compliant Zoom licenses, just like this platform here, for providers across the state who might be interested. They can essentially leverage the university's Zoom licenses to be able to provide telehealth. Now, that's not hardware, but that's certainly some software support there. That consortium and that telehealth network also offers training and assistance, technical assistance for providers and for patients or other organizations. And the Department of Health budget for this program is quite small, relatively speaking. It's about $189,000 a biennium. So back of the envelope math, I think that's less than 0.01% of the Department of Health's budget, but again, really engaged in cultural awareness, promotion of telehealth as a means to receive healthcare services. A couple of interesting facts when it comes to telehealth that we see in our Medicaid claims data, as well as other health data across the state. And it won't surprise you that behavioral health services are kind of lend themselves best for telehealth. That doesn't mean that other consultations and other services can't be delivered, but what we've seen over the past couple of years is specifically behavioral health services like counseling, psychology, psychotherapy, other behavioral health related areas are typically the most used when it comes to telehealth services, and thus for us, the most reimbursed telehealth service for the Department of Health through Wyoming Medicaid. We have, again, another interesting kind of development. We have seen a significant increase over the past 2 months, probably unsurprisingly for you all, in the use of telehealth during the COVID-19 pandemic. Makes sense, stands to reason that folks who would have potentially gone to a provider, gone for some counseling, gone for a primary care consultation might have done that over telehealth. And accordingly, we've seen some additional providers come on, both in providing telehealth services in Medicaid, as well as joining that telehealth network and consortium that I mentioned earlier with the University of Wyoming. Some of the areas being discussed as it relates to telehealth, both legislatively and in the executive branch over the past couple of years, and heating up a little bit in conversation during this COVID-19 pandemic. A couple of things that I'll just mention briefly is broadband access. I know there's some folks that are testifying behind me that will talk about more of the technical and mechanical details around broadband. Secondly, it's been mentioned many, many times that more provider education and awareness for providers, healthcare providers, that telehealth can be used safely, can be reimbursed. There's a lot of policy, rule, and reimbursement discussions that happen around provider education. Third, patient education for telehealth is again something that I think we've been engaged in with our partners like the University of Wyoming to do some promotion and awareness specifically for patients that you can receive services, especially in lieu of driving long distances, can receive some services over telehealth, and specific to the Department of Health's programs like Medicaid can also be reimbursed and covered. And then finally, the question that's coming up over and over now is what can we do with the CARES Act funds that might potentially support telehealth or telehealth services, telemedicine services across the state of Wyoming. So that's the second thing that I'll talk about very briefly. And I'll make my comments specific to the 1.25 billion CARES Act allocation specific for state government, as opposed to some of the other CARES Act funding sources that are out there, and some CARES Act funding sources that are out there for telehealth specifically. The FCC, I believe, received a telehealth CARES Act grant, mostly to support providers' technological capabilities to serve their clients during this time. But again, I'll speak specifically about what I think everybody's interested in is this, how can we use the 1.25 billion that's been allocated to the state government here to support a program like this. To put it succinctly, I think for telehealth programming in schools that don't already exist, it's hard to imagine that these CARES Act dollars could be used on a sustainable basis going forward for any program that might continue beyond the public health crisis, beyond COVID-19. And I know we all hope we get out of COVID-19 as soon as possible, but with these CARES Act dollars, not only do they have to be obligated by the end of December this year, but if a program were stood up in a school district or at a school or statewide that required ongoing expenditures or funding, I think the CARES Act dollars would not be relevant in that context, or if used would present kind of a heightened audit risk when it comes to the Inspector General's likely auditing of the use of these CARES Act dollars. Now, however, I will mention that when it comes to startup costs, and I'll use that term loosely, but since these funds have to be directly related to, I believe the language in the US Code is necessary and incurred due to COVID-19, I think in terms of preparing healthcare providers, in this case, potentially preparing school districts for future needs related to COVID-19 or related to respiratory virus pandemics, then telehealth infrastructure in school districts could potentially be an avenue to use funds. Again, not on a sustainable or an ongoing basis, but really as a startup cost. So that's certainly a possibility, but I think that sustainability problem is certainly there. Mr. Chairman, a few policy considerations when it comes to telehealth in schools that I wanted to put before the committee, and then I'm happy to answer any questions. Medicaid and private insurance coverage of telehealth services in schools is really where many states have kind of centered their telehealth school policies around. We can certainly provide this committee with some analysis we've done across states and localities around the country of how they've set up telehealth programming in schools, but Medicaid and private insurance reimbursement are typically what you see with school districts providing telehealth services to kids. Essentially, the school district or the school itself would become a billing entity to bill private insurance, bill Medicaid, bill any other pay sources that might be there. Secondly is the issue of consent. This is probably a down the road consideration for the committee, but any telehealth services that are provided in schools, what we typically see across states, localities, districts, what have you, is parental consent for students to receive telehealth in the school, and that can really vary. But again, happy to provide the committee with some of our analysis of what that has looked like. And finally, I think local and statewide provider partnerships would be important if a telehealth school program was going to be stood up. The few examples that I'll mention, Sioux Falls, South Dakota has used a kind of managed care system to stand up a telehealth program for all of its 31 schools in Sioux Falls. I believe it's Avera Health. It's a Catholic managed care health provider in Sioux Falls. So they essentially route all of their telehealth services, reimbursement, et cetera, through a managed care entity in Sioux Falls. And that's one model that we're seeing crop up more and more and more as it relates to school districts providing telehealth services, and really a mechanism to, I think, make it administratively simple for schools. So essentially having an administrative entity handle billing and reimbursement and things like that. The Children's Health System in Dallas, Texas is another example, kind of more on a local basis, but a little bit wider scale than the Sioux Falls example I mentioned, where they've created a system that consolidates and makes it easy for the school district to bill for telehealth services. But Mr. Chairman, it really does come down to, with this topic, what problem we're trying to solve in the state through telehealth in schools. I know school-based services in healthcare has been a topic for this committee and the labor committee that we usually testify in front of over the past couple of years. That bill most recently was vetoed by the governor. So in terms of Medicaid-based reimbursement for telehealth in school districts, it does happen currently, but not for basically healthcare providers like school nurses that are employed by the school district. That would have changed with the implementation of school-based services and would have come to a cost to the state. But as you all know, the governor did veto that bill, essentially saying it wasn't quite ready for prime time, needed to go through some more thought. So we don't have a full, robust Medicaid school-based services system right now, which would include telehealth. But there are services that are provided in the schools via telehealth for some Medicaid students on kind of a situation-based basis. So if a provider, school was to connect a student to a provider out in the community for some services, from the school to the provider via telehealth, that is a reimbursable service under Medicaid today. But again, a more comprehensive school-based services system for Medicaid is not in place in Wyoming. So again, Mr. Chairman, in closing, I think the use of these CARES Act dollars, like I said, happy to provide this committee with more detailed analysis of what we've seen in other states, what we as the Department of Health think is both reimbursable and not reimbursable when it or covered by the CARES Act dollars when it comes to telehealth. But it really does depend on the problem that this committee, the legislature, and the state would be trying to solve with the use of CARES Act dollars as it relates to telehealth. So, Mr. Chairman and members of the committee, happy to stand for any questions.
Questions for Stefan? All right, none appearing. Thank you, sir.
Thank you.
Well, we're going to move on to Gordon Knopp from the Wyoming Chief Information Officer and Agency Director of the ETS. Gordon, are you on? Says it's connecting. All right, it says you're muted, Gordon, if you're ready to go. Unmute and we'll take off.
All right, thank you. Sorry, slight delay between what I had on my phone and here, so I'm in sync now. Thank you. Mr. Chair, committee, thank you for having me here. I would like to introduce the speakers that we'll have. We did have Ken Reynolds from the WDE, Jason Miller and Rick Eckhart, or I'm sorry, Rick Fortney from ETS, and then Ryan Kudera from the Wyoming Business Council, the broadband coordinator. They were hoping to present in concert, beginning with Ken and then Jason and then Ryan. So with your permission, could we bring them into the room?
That'd be great. Let's see if we can get it done.
Okay, thank you. As we're bringing them into the room, I'll give you a slight overview, and I appreciate the information we got from the gentleman from Health. And I know we're facing a tough concept, right? For those of you who are unaware, I spent the last 29 years in education as CIO and as a teacher at multiple levels, from the college to the high school. And the digital divide has been a real issue for years and has been exacerbated in the last few months as all of our students, K through 12 and post elementary or post into the colleges, had to go home and work remotely. And I'm sure that's what's started this conversation, is how do we help address those families where the students are unable to connect to complete their work online. So to that end, I know Ken will talk to some of those things from the WDE. I know we'll provide some information from ETS, some brainstorming ideas that we have on how we could leverage the state network to potentially help with that. And then I know Ryan Crudera will talk a little bit about what we can do from the business side of the world to help ease this issue. Please do know that this is an issue that's been talked about at every state this spring. So there might be some wisdom there, and it's been talked about in school districts for years with multiple levels of success depending on the situation. But what I would offer for your consideration is kids who can't connect usually have one of two issues. They're either in families of poverty where there are connections available and the family just can't afford it. So that would be one area. And then in Wyoming, because we're a frontier state, we're not a rural state. I mean, we're beyond rural, right? We have frontier, we have a difficult time providing connections to where some people live because of the sparse nature. So forgive me if that's redundant to any of you, but I wanted to set the table for that conversation. And then with your permission, I would like to turn it over to Ken Reynolds, and then from Ken, Jason Miller, and then from Jason, Ryan Kudera. So I'll stand for any questions before I hand that off, if you're okay.
Questions for Gordon? Okay, we'll take it to Ken. Go ahead, Ken. Is Ken on?
Can you guys hear me okay?
Yes.
Okay, apologies. I don't know what happened. I'll start over. Thank you, Director Knopp, and thank you, Mr. Chairman and committee members, for the invitation. I'm Ken Reynolds, WDE's Information Management Division Director. I, Jason Miller with ETS, and Ryan Kudera with Wyoming Business Council have tag team for this presentation to broach the needs of and for teleeducation collaboratively. I would like to address the issues recently uncovered of connectivity or lack thereof and its impact on instructional delivery. Jason will follow up with ideas for consideration and available and future technologies to bridge this gap. And Ryan will back clean up with data input and opportunities. In the land before COVID, there are really two tales of connectivity related related issues in K-12 education. First, the classroom connectivity gap, which refers to the level of broadband availability to and in our K-12 schools. I would be remiss if I did not point out the fact that Wyoming has made great strides in this area, from the Governor's Office Wyoming Classroom Connectivity Initiative, Education Superhighway, ETS WDE, and the district's leadership efforts have had a significantly positive impact on the delivery of broadband to our classrooms through the Wyoming Unified Network. According to current ESH data, Education Superhighway data, the median bandwidth per Wyoming student is now at 1.55 megabits per second, which is above the new FCC minimum bandwidth goal of 1 megabit per second per student established in 2017 within the four walls of the schools. So this information is relevance will be fleshed out in Jason's segment as it possibly could be leveraged. Which brings us to the issue that is front and center today. Connectivity at home is no longer just an issue with students completing homework assignments. It has become the Achilles heel in delivering education as the schools, districts, and states, and our teachers and students have been forced to transition from the availability and comfort of classroom, high-speed internet, or teleeducation, or virtual ed, or remote learning. The homework gap, our teleeducation gap, is now a front burner issue. It has exposed a significant weakness and the need of a more holistic solution to instructional delivery. Unfortunately, the actual data on connectivity issue is disjointed, inaccurate, or just not available, which Ryan will discuss. Recent conversations with district leadership and educators reveals the evidence of challenges to virtual education. Some communities and families simply don't have access to any connectivity, be it 3G or 4G cell, fixed wireless, DSL, cable delivered, or even satellite delivered. Usually rural, but even some urban or suburban areas have dead spots of no coverage. B, a larger percentage of reported issues is that of insufficient bandwidth available to families, which may be a result of the carrier's infrastructure inability to deliver adequate bandwidth to a town, neighborhood, or community. Other potential impact may be teleworkers in the home, the number of simultaneous users, the number of concurrent devices attached to the wireless, such as connected appliances, streaming multimedia, smart speakers, communications devices, security cameras, and of course, online media and gaming competing for the limited resource of bandwidth. And C, a third reported issue is that of affordability, which may have causality in the inadequate bandwidth. Parents simply purchase the bandwidth that they can afford, and as with satellite delivered access, most of those plans are metered, resulting in expensive monthly bills. This category is, of course, a financial consideration, not necessarily tech. In the mad rush to migrate to an online learning environment where possible, hence the term adaptive learning versus virtual learning, districts were very innovative and quickly reactive for short-term solutions. It is indeed remarkable the management of the tempest of change that districts and school administrators, teachers, staff, and parents endured and overcame in continuing to provide an education to our students. In conclusion, it is time for a proactive mid and long-term solution to Wyoming's teleeducation challenges. Mr. Chair, with that, I turn it over to Jason Miller with ETS for the continuation of this presentation. And thank you.
Go ahead, Jason.
Good morning, Mr. Chairman and committee members. Thanks for inviting us to have this conversation about broadband and connectivity for students and the population in general. Obviously, it's a concern that we've had for a while, and everybody working from home has certainly brought some of those inadequacies to light. So what we're going to go through on this little presentation here is just some of the options that the team here at ETS, while working with other folks around state government and outside of state government, that are different options to be able to utilize the network that we've currently built internally. It's been an interesting process as people have worked from home, because we built the network, the state network, pretty robust network, but it's built from the inside out, expecting all the people and traffic to be inside. And now everybody is outside coming in. So it's been an interesting dynamic looking at the changing in data traffic patterns across the network. Anyway, so yeah, we'll go ahead and go forward with this. But I'm Jason Miller. I'm the IT administrator here for ETS. With me, I have Rick Fortney. He's the Deputy CIO, Deputy Director here for ETS. I'm not sure who's running the slides, but if you can go to the next slide, there you go. So again, trying to address some of the digital divide that Director Knopp mentioned earlier. These are some ideas that we've come to be a short-term and like a little bit longer-term options for consideration for additional discussion. So the first option is the client access wireless, and I'll get into that here in a moment, as well as point-to-point wireless connections. We go to the next slide, please. So just so we're all talking the same language, when I say client access wireless, what I'm talking about is exactly what we use right here, right? We're all using a wireless connection on our PCs, you know, and Ken touched on it earlier with some of the wireless devices in houses. It's widely available. You know, it's the same thing you use when you go to Starbucks. It's the same technology across the board, whether you're at a state government building or if you're at Starbucks or Target or wherever. So we're all used to this type of connectivity. We're all used to interfacing in this fashion. Not much of a learning curve for students to be able to connect this way, for us to be able to connect this way. There's you know, a wide range of availability of this kind of service. It is obviously limited by distance. It's contained by or interfered with walls and such. Is there a question?
Mr. Chairman, I believe Senator Hutchings has a question.
Very good. I can't see her, so go ahead.
Thank you, Mr. Chairman, and thank you, Matt. My question is to Jason Miller. Is there a way you can share your screen so we can see your slides? I'm looking through the list of what's provided for us, and I don't see any slides in there.
It's shared on my screen. I don't know who's actually sharing it, but I can absolutely share my screen, but someone has it shared already.
Yeah,
Mr. Chairman, it is being shared, and if Senator Hutchings can't see it, another option would be for her to go to our meeting materials on our website. It is available.
Which number, Matt?
Mr. Chairman, it is the 12-02.
12-02. Thank you so much. I see it now. Appreciate it. Thank you, Jason. Mr. Chairman.
Go ahead, please.
Yeah, the one thing I want to touch on that is the security is configurable, and that's obviously something we want to touch on always. There are open wireless accesses out there. So security is always something to think about when you're connecting to those access points that aren't secured through some type of encryption or at least login credentials. All right, so if we go to the next slide there. So what we've kind of come up with for a possible solution for specifically client access wireless. There's a lot of technologies out there that would allow us to mount access points on the outside of state buildings or school buildings that then would broadcast a standard client access wireless signal into a parking lot. Now, there's been a lot of states kind of doing this kind of thing already. It can be used for multiple different functions, whether it be, you know, community locations or specifically for students going to the parking lot to either download assignments, upload assignments, participate in any other kind of online practice there from a parking lot. It is scalable to larger parking lots. So, you know, if you think of a small elementary school, you could put an access point on the outside of that building and broadcast across that smaller parking lot. Or if you think a larger location like a high school or anything like that, what we can create is more of a mesh kind of network. So you still have that access point on the outside of the buildings, but then it communicates to other devices that we mounted on, say, light poles or other locations around the parking lot to then enhance that signal farther out into the parking lots. It would help with people make sure they maintain correct spacing and that kind of thing as well as actually broadcast the signal across all of that. Like I have on the slide there, a lot of the pros and cons of that, they are relatively easy to install and a pretty short timeline to be able to get them out and stood up. It's a one-time cost for the physical hardware itself. So that's pretty easy, pretty easy piece right there. And as well as it can be managed either from an enterprise, so you have like ETS or some other agency managing that entire infrastructure, or it can be deployed to each school district, and the school districts themselves can manage them.
Can I ask?
Yes.
All right, Senator Ellis.
Thank you, Mr. Chairman. I just want to visit about this concept because I think that I've heard this was happening in South High, which is in my district. You had students going into the wireless capability of the building. So I'm wondering if this is, first of all, I don't know that this is a solution for elementary schools because the notion of a high school student driving to a parking lot makes a lot of sense. But for elementary students, I don't know how much that'll be utilized. And the second, if this is already happening at South High and our local districts, do we really need like a statewide plan to get there? I mean, we hear a lot about needs of large districts versus small school districts. And so I'm wondering if that discussion, or have ETS had that discussion as it came up with this proposal?
Yeah, we have talked to a few school districts and a few providers about this exact thing as well. And you're 100% correct. One of the cons that we have written on there is obviously the parents would have to take the children to the parking lots or that kind of thing. So it does create a little bit of a hassle on that front. And like I said, we're just, the whole thought behind the idea of these is just to try to enhance some of the availability of the broadband we have built into the network itself, as we're working with the providers to build out to the communities themselves, which is the long-term solution to this problem. So it's a kind of a stopgap to allow the people that don't have connectivity at their house, give them an option. And like I said, this doesn't have to be specifically on a schoolhouse. It can be on a state building, a YDOT shop. There's lots of different applications for this kind of technology. Just to allow a common public place where people can go and know that they can get connectivity to high speed.
Well, two, I guess. You mentioned that you talked to some folks in industry. I'd be curious to know what industry's perspective is, because I do have concerns when we start going down this path of creating a government entity that competes with functions that are normally provided by our private sector. And then along those lines, you identified some of the gaps that exist. And in all candor, I've got 3 kids at home. I can't tell you summer didn't come soon enough for me. And you're right, it is sharing devices. One challenge that we experienced very much in my household was we have Apple devices and iPads that weren't compatible with a lot of the district's apps. There were multiple icons that we had to click on. And so some of the difficulty I had as a parent was just in not knowing how to use all the technology and having 3 kids and 3 separate passwords and juggling all of that. And so I'm wondering if that discussion came into play of how do you simplify some of the technology so that it's available on iPad or other tablet type devices that aren't maybe as expensive as a desktop or a laptop computer that was required for a lot of my kids' lessons. So those were my 2 questions.
Mr. Chairman, Senator Ellis, like I said, we did talk to a couple of the providers in the state, and this specific function is not necessarily a competition to what they're doing. A lot of them offer this service as well. What I'm talking about is purely just utilizing the circuitry that we currently have installed to be able to provide this service. Wireless is something you can generally get if you approach a building anyways, just based on the scope of the wireless connection, right? What I'm looking for, what I'm talking about is more enhancing that signal outside of the building itself. So not necessarily competing directly with a provider, which is certainly something that we want to keep in the forefront of our thoughts as we go through that. And to the techno.
Can I interrupt you for a moment? Gordon has a comment. Go ahead, Gordon.
Thank you. Mr. Chair and Senator Ellis, I would offer for your consideration that what you've experienced at South High School and what happens in a number of districts across the state is there's overflow signal, not intended to necessarily be used in the parking lot. However, it is accessible. What Jason has put together is making a more conscious effort to spread the signal across the parking lot so we know it's there and we know it's available. And that's why many of the vendors don't perceive that as a threat to their in-home service, because you have to leave your home and go to the parking lot. Now, some vendors certainly can perceive that differently, and I don't want to try to say which vendor is going to say what, but it does create some consternation. But again, to Jason's point, we have seen this happen, not necessarily with full planning to have that signal used for this purpose. Often those signals are made available in schools as they're being built for outdoor activities. So as an example, as a PE class is taking place outdoor, they may have devices with which they monitor physical activity or something like that. And you need to have that connectivity to do that regular classroom instruction when the students are in the environment of the school. We're now talking about repurposing that. So again, it's not necessarily a fix-all solution, but it is an option that would be relatively easy, and I use air quotes that, well, I guess you can see that, sorry. Easy is a relative term because that could be stood up in a short period of time, coordinating with the school districts and their tech departments. And again, some already have wireless access points on the outside, some don't, and that's been up to them. But to your second point in question about the universal accessibility of the programs that a district may choose to use, whether it's used on an Android platform, an Apple platform, or a Windows platform, that unfortunately isn't something we do at the state level. And I can tell you that in my past life, that is something that we struggled to find with the cost effectiveness. Some programs may have that technical capability, but then from an educational point of view, it doesn't have the educational quality that you'd like to have. And so that's been a push me, pull you type of thing, trying to get that figured out. I know there is discussion at all the districts, at least there were as I left over a year ago, to try and remedy those situations. But in your ask as to whether or not we discussed that during these things in response to this COVID, that was not part of a discussion that we focused on. That could be a discussion that K-12 people focused on. But inside of ETS, we focused on just the bandwidth and trying to get the connectivity, not necessarily the apps that a school district would choose to purchase or use. Does that help?
Go ahead, Senator Ellis.
Thank you, Mr. Chairman. It does. And I'm trying to think of the way forward, because I think we all agree that having that be the solution where you're going to get in the car and drive to a parking lot and start doing work. Again, I have 3 kids. And I can't imagine if I, didn't have an internet signal at my home and I had limited devices and I've got a job that I'm trying to hold down as well, that a really great solution is, okay, everybody, let's get in the car and drive to South High for the parking lot internet. I mean, I think if we had, I'd be curious to know, I guess, like the cost benefit of what would it take if we did a survey, a robust survey, to get an understanding of how many families lack internet, not because of dead spots, but just because they can't afford it, versus having an inventory of how many people just don't have internet access at their home because they live in a rural area or in a place that's a dead spot, and then really drilling down on understanding how many families simply can't afford it. I think it would almost be cheaper to pay the family and give them a stipend to have internet than it would be to do all this retrofitting and trying to have boosters in the parking lot. I'm just trying to think of how to do this most efficiently, and obviously trying to not create things that we can't sustain and won't make sense in our future.
Go ahead, Gordon.
Mr. Chair, thank you. And Senator Ellis, I understand exactly where you're coming from. And until we have such data that you mentioned, right, we won't be able to make those decisions. So sans that data being available, that's where we came up with these as ideas, right? They're not going to be great ideas. But this is the first of two ideas that that we have for consideration, right? And we'll turn these into the governor per the executive branch approach. But we're also trying to make sure we're not stepping on the toes of private providers and ISPs. I will tell you, other districts who have tried to take care of this in the past, now before COVID, right? There are examples where you bring on a family liaison who works, whose job it is to work with families of poverty, try and line up discounts that are available through vendors that are already out there, or grants or something like that, to try and get them connected. Sunnyside School District in Tucson, Arizona is a good example of that. Their entire district is Title I. And for the benefit of the group here, that that means those families are families of poverty. They're families of diversity as well in the Tucson area. And that's how they approached the issue, was they were able to, through the ISPs that were out there, they were able to leverage grant programs for those families to connect for the purpose of those kids being able to do their homework in the evenings. That may take care of that situation, maybe, for families of poverty. That's just one idea, but there's lots of ideas out there. But I agree with you. We need some data.
Mr. Chairman.
Good.
Last comment. I mean, the data is important because we can provide all the broadband we want, but if the family doesn't even have access to a computer that the technology requires for the apps and uploading all of the assignments, then we can focus on providing all the broadband we want all day, but it won't make a difference if they don't have the devices. So we really do need this data. I can't emphasize that enough.
Ken Reynolds, you have a comment?
Mr. Chair, thank you. Ryan will address the data collection in his segment. So it will be covered, and it is important. Thank you.
Thank you. All right, Jason, would you like to continue? Oh, Chairman Coe, go ahead.
Yeah, thank you, Mr. Chairman. I'm just curious, and I guess this question for Gordon. Has ETS, in fact, communicated with private industry on this issue? Or are you ongoing with communications with private industry? Because I have heard that maybe ETS is not communicating with private industry.
Go ahead, Gordon.
Thank you, Mr. Chair, Senator Coe. We have met with private industry upon occasion, but primarily that's through the Wyoming Business Council. We meet with private industry, the vendors with whom we have contracts with that provide this type of thing. Now, aside from that, that is through the Wyoming Business Council and the Broadband Coordinator, where we've had conversations with private industry. Aside from that, we've had one phone call where a person from one of the ISPs or the vendors, they called and said, can we speak about this matter? And we had a meeting that same day when they called.
All right. Thank you. Okay, we'll go back to the presentation. Jason, again, it's yours.
All right. All right, and again, like I said, I think, like we have just talked about, I think that the serious con there is that they have to drive to the parking lot to get that done. That's certainly something that we've thought about through some of this process. I'm going to go to the next slide, although it's gone. Can anybody else see the slides? There we go. Perfect. All right, so this one is a point-to-point wireless. So this is technology used for a short-range outdoor communication that connects two buildings where you may not have a copper or optical fiber line between those two locations. This is generally used for it's used in various other industries as far as connecting cell towers to other cell towers. Some type of microwave backhaul, that kind of stuff is part of this as well. Like I said, this right here connects two locations that don't necessarily have a connection direct. If you want to go to the next slide. What the opportunity here is we can connect through a mast or some type of tower at a state location, at a state location where we have connectivity, and we can broadcast that signal to an individual house. Again, now this would provide connectivity to an individual residence that may not have connectivity. to bridge that gap until the providers can build in there, or we can identify some of those other factors through the process here. It can be scalable to other locations, similar to, like I just mentioned, how cell towers can backhaul between each other for connectivity. You can do the same thing with this type of technology as well to reach locations that are farther out or more remote. Obviously, the cons of this is does have that significant install time. It is not a solution for everybody, being that it serves individual households, not a wireless thing where you have people coming up and everybody can get on. It's more individualized. It's unlicensed in the frequency band, so it's susceptible to some kind of interference, to block, or issues with foliage, that kind of things. As well as then now we'd have to be able to support equipment in houses and things like that. So there's a lot of issues. There's a lot of hurdles we'd have to cross to be able to get this kind of thing done. It is certainly not a short-term solution. It more addresses a longer-term middle gap thing. It's something that providers can do as well, stand up this kind of equipment. Again, like I said, it's kind of ideas we're discussing as ways to address some of the problems that we know exist out there as we work with the provider or the industry to be able to build up some of that infrastructure to actually support the connectivity long term. If you want to go to the next slide, if they're up there still. So in conclusion, basically, like I discussed earlier, the client access wireless piece is a short term, gives the community a place to go to get guaranteed connectivity, albeit not a permanent solution and not a complete answer to the long-term problem, right? But again, it does get us over a certain gap. The point-to-point wireless piece is a much more complex, and like I said, it would fill a middle gap piece there until the providers were able to build out some of that network. And I really can't stress enough that we need to make sure we keep these conversations of broadband connectivity with the community, with the providers involved in that, because we have to build that fiber foundation within Wyoming to build all of these other pieces on. And whether it be cell service or fiber to the household, as some communities have done, all of that has to be built on a good solid foundation of fiber networking there. Even when you talk LEO satellites, low Earth orbit satellites, you're going to have those fiber still part of that ground station connectivity. With that, I will stand for any additional questions, comments, or discussion.
Questions for the guys? Go ahead, Senator Landon.
Mr. Chairman, thank you. And Jason, you probably in part answered my forthcoming question. This, by the way, will be the first of 3 days out of the next 5 that I think we'll be visiting. I was named to that broadband task force, and with that in mind, I was going to ask you, in a utopian world, what would be your 1 or 2 or 3 things that task force could come out of there with as recommendations? It sounds like really the first and foremost is to lay fiber optic line. Am I reading that correctly, or what are your thoughts on that?
Mr. Chairman, Senator Landon, I do have our representative, Senator Landon. I do have some thoughts on that. Of course, fiber is going to be that backbone. It's scalable. It's a long-term investment in infrastructure in Wyoming. Really, where I would see that committee, what comes out of that committee is what that long-term plan looks like, and actual achievable goals to it. We've talked quite a bit about the 25x3 requirements and all of that kind of thing. And I really think that we need to start looking, we as the collective need to start looking more long-term for what our kids are going to need and what our kids' kids are going to need as far as connectivity. Not to get too deep into the weeds on some of that stuff, which I can do from time to time, but that really looking at symmetrical services, and by symmetrical I mean same upload speed as download speed. Right now, with the 25:3 is great for watching Netflix and those kind of things, but when you're talking teleeducation, telehealth, working from home, what this looks like in the next 10 years is going to change. And we need to make sure that we, from that task force, and we, the collective, right, are able to support the long-term destination for all the communities in Wyoming to be able to supply that connectivity for the teleeducation, all of those pieces. What we're doing and what we're talking about right now is highly important, and it's going to be important for the long-term well-being of the state of Wyoming and the people who live here. I think what we're doing is very important.
Really appreciate that, Jason. Thank you, Mr. Chairman.
Senator Hutchinson, go ahead.
Thank you, Mr. Chairman. This is for Jason, and again, we travel a lot, and my husband and I, we don't rely on the services provided along the road. We carry a little jetpack. It's about the size of a mouse, and we're able to get sustainable internet connection for as long as we want. And I've used it for these committee meetings, and it seems to work real well. But going along with what Senator Ellis says, it seems like the state is trying to take on a role that the private industry should be taking on. But if the state does do something like that, where would a jetpack fall in line here on your idea number 2, point-to-point wireless? Could that be used instead of burying cable from home to home? Just a question.
Mr. Chairman, Senator Hutchins, the jetpacks are obviously that's a solution that we've discussed as we were sending employees home to work from home, and all of that works on LTE. That's like your phone piece. What I'm talking about, it certainly fits a niche, right? There's never going to be one answer for everybody. When I'm talking fiber and when I'm talking that kind of build out, I'm really talking the scalability of that service, the availability and the long-term availability of that service. Your jetpacks, and like I said, are perfectly fine, just like hotspots on the phone, that kind of stuff. It's all great technology, and it works well. It is dependent on wireless, LTE signal, and then also, what feeds that LTE signal again is fiber. So building fiber to those towers is highly important for the visionary folks or for the Verizon folks and all of that. So they all kind of, again, like I was saying, we build that fiber foundation, and then these other pieces can stand on that foundation and deliver services.
So Jason, I'm listening to you say building fiber and getting fiber into the ground. Wouldn't it be advantageous at this time to get all hands on deck and get more fiber put in the ground using some of the CARES money?
Mr. Chairman, yeah, absolutely. And we've talked about those pieces, and the problem at least that I've come up with on that, or the issue that we'd have to cross, would be having it installed and purchased by the end of December. Fiber build out in the state of Wyoming is not a short term. It's not something that can be done in 6 months. We have pretty small construction windows, especially when you're boring into the ground with the ground's frozen. We have unique challenges with laying fiber. So honestly, it's a long-term commitment. And again, it kind of goes back to what I was saying with the task force. It's a long-term commitment that I think the state of Wyoming, in partnership with our vendors, commit to keep moving this down the road to deliver those services to the households across the state, not just the Cheyenne where it might be financially viable, but the Bill Wyomings, those smaller places are just in as much need as as Cheyenne, where you know the ROI is probably better for a location that has this many people.
Senator Ellis, you have a question?
Thank you, Mr. Chairman. You know, and I know that you're coming to the Education Committee. I'm guessing this isn't a place that you normally arrive, but Gordon, you know, having worked for the school district, I'm sure we're not completely unfamiliar to you. Again, I just want to drill down on the fact that I still don't understand the magnitude of the problem. You know, we've had a dramatic shift in how education's delivered statewide, with every student learning from home. I can tell you that, you know, we kind of did, when you talk about, you know, not a virtual learning environment, but an adaptive one. I certainly picked up paper packets, returned paper packets, scanned those, things that didn't require a lot of technology. And I want to commend the people in my school district and a lot of the teachers for making those packets, for calling families, for going above and beyond to make sure that they were reaching out to families and kids. But the hard part is, you know, we had so many challenges getting through this spring. And it just seems like we keep assuming that the whole reason that it's been difficult is because of lack of broadband. And I just wish we had our hands around some numbers about how many students really that this was the reason that they were struggling to learn. They didn't have a teacher that provided a paper packet. They didn't, you know, have a place where they could drive and have a little bit of Wi-Fi. They didn't have a device. I'm craving that information. And so along those lines, like before we start talking about, you know, lack of broadband, what we need to invest, I'm just kind of curious what kind of dollar signs you're thinking about to really get after maybe, you know, universal broadband in the state of Wyoming. And at this juncture, I am concerned about ongoing costs and maintenance of going down that path. So if you have any numbers that you can share with us, even if they're back of the napkin, I'd appreciate it.
Who would like to take that on? Go ahead, Gordon.
Okay, thank you, Mr. Chair. Senator Ellis, at this time, I don't even have back of the napkin numbers because what we were doing was responding to the same ambiguousness that you're speaking to because we don't know the numbers we're talking about, right? I have some visibility into what Laramie County School District 1 might be experiencing based on my past work and some around the state, but I don't know what happened at COVID time. And unfortunately, because of that, I don't. We just looked at, given the unified network that's across the state, what would the options look like, right? Because maybe we need to add a few access points, and I'm just making this up to be clear, you know, in 3 districts, maybe it's in 20 districts. I don't know. And then, so of course that makes that variance great, right? We do have a little bit of data if we do the point-to-point concept. That might be beneficial, and I'll let Jason respond to those to make sure I don't jack up the numbers because he did the legwork. But again, because we don't know the ramification or the demand or the need, I can't give you total overall numbers. So I apologize for that. Until we have some more data, I won't know that. But Jason, are you able to provide, I think there was a per unit anticipated cost for one of those 2 solutions? Is that something you could provide?
Yeah, from some of the information we received, and again, some of it's some hard numbers, some of it is still in the discussion piece. But as far as the client access wireless, which is the devices on the buildings and or mesh network across the parking lots, we were estimating about $3,000 per location. Again, that changes depending on the size of the parking lot. It'd be less for a smaller parking lot and a little bit more for a large one, but that would be about what our average was. And for option or the idea 2 there, that one is a little bit different, a little bit more. We'll still need some research on that, but you know, depending on like if you have to purchase towers and some of those regulatory things, I think certainly have some cost that would be an unknown piece to us. But those you're talking probably around $50,000 per location, and then maybe about another $500 per house that you would have to connect to those.
So if I may, there's also costs that aren't hard dollar costs, right? So on that second idea there, if you start to put towers around a community, then you've got municipality, whatever regulations there might be. And I think, and forgive me for a Cheyenne-centric perspective, just because it's been a recent conversation with City Council here, they've talked about bringing in miniature cell repeaters. And there were a lot of city council ordinances and things like that that had to be addressed or worked through. And that took the city council months to work their way through that. So those types of things would potentially be a slowdown in that situation. And again, because we don't know yet what communities we'd even be talking about, we couldn't go much further, right? So that's just where we're at from a technical point of view. These are two options that are out there. But again, to your point, Senator Ellis, I can't target, whether we needed in Albany County, Teton County. Unfortunately, I'm unaware.
Okay. Anybody else? Any other questions? If not, we'll move on to Ryan Kudera from the manager of the Wyoming Business Council. Ryan, are you on?
I believe so.
Here you are.
Hello. Thank you, Chairman, and everyone. Pleasure to be here today. Want to introduce kind of where this got started. Fortunately, I came in middle of January, so this is new to me as well. So going into this, legislation was passed in 2018 to provide the framework for the Wyoming Broadband Initiative. It's been to lay the foundation for the future of broadband in Wyoming. And beginning with this plan that you see in front of you, it's Wyoming's first enhancement plan. It was developed within 3 months of the initial meeting of the Broadband Advisory Council. And this plan has helped serve several of our broadband providers in accessing federal grants. As those federal grants have, they're a scoring-based mechanism, and a state having a broadband plan adds to that score. So this plan is currently under review. Will be reviewed every biennium to keep up and move forward with current trends. So we can look forward to that later this year. Please proceed to the next slide. And out of that, just some basic introductions. This is who makes up our advisory council for the Business Council. We have, as you can see here, we have a variety of membership from providers to legislators. Mr. Knopp is involved, as is Mr. Miller. We've got education, and then we have a required member from the Wind River Reservation as well, just to make sure we're covering all the facets and needs of the state for broadband as we can. Within our committee, or within the advisory committee, we have 4 subcommittees currently. One specific to telehealth. It has been in existence since 2018. We've been participating with the Wyoming Telehealth Network, the Department of Health, in trying to address and get a further understanding on the telehealth issues. Education, that one is multifaceted. As we're speaking with the Joint Education Committee, that is involved as well, as is education of the citizens for broadband as well, which you'll see later in the presentation. We do collaborate with, of course, Department of Ed, ETS, the community colleges, and a quick blurb on that is been in contact since I came on board about developing a program by which trains broadband technicians. It became very apparent the need, as many of the colleges that used to support that don't anymore. And not only will it provide additional trainings for community college, it will provide for additional job creation and economic development within the state. And that has been very participated by with several providers in the state, with interest from providers out of state. And then, of course, working with University of Wyoming on several different levels. Another committee we have is for the funding committee, and that's to explore any and all potential broadband funding for the state. And not only just for the state, but more specifically any telehealth, teleeducation, anything we can find to use, all the way down to public works. And then the last one is known barriers. That one again also has been in existence since 2018 to try and look across Wyoming, look across the rules, look across cities and say, okay, what are some of the barriers that we're going to encounter as we move forward, trying to build out broadband across Wyoming. Go ahead and go to the next slide, please. Thank you. This is our mission. Enrich lives, enable economic diversification of Wyoming, and then put ourselves in a position of leadership in the new digital world. That digital world, as we know, changes almost daily, as we've encountered in the past several months. And we stand to the vision. We want to have every Wyoming citizen and identified business corridor. Those are areas that we need to serve by 2023. And then moonshot, ultimately, we don't want to have any Wyoming citizen left behind from adequate broadband to do the business or education that they need. And then just to move forward to the bottom tagline of fairness.
Well, Mr. Chairman, can I interrupt for just a minute?
Certainly, go ahead, Chairman Coe.
Would you let Senator Rothfuss and Representative Connolly back in?
Yep. I was just working it myself. Please go ahead, Ryan.
Okay, thank you. I'll wait for the slides. Hey, basically, it's just a statement on how we're going to try and do that across the board with our Wyoming providers, our broadband providers, and basically make a nice environment in which we can work together and move forward. If we can have the next slide, please. All right, thank you. And then inside of that plan, trying to address the stakeholders' needs. This is, being able to look across the board from the citizens and the businesses, the providers, the governmental agencies, and, education, healthcare, et cetera. Be able to throw all that in one big bowl, stir it together, and see if we can't meet the needs of everyone the best we can. It's a tall order, but that's what we're going to do. Please move on to the next slide. Hey, our priority recommendations at this time, and there's several more, these are just some that I pulled out from the top, is in our case, we have the funding for the broadband grant program. And a large part of that is to leverage the private and public partnerships. Those are necessary and required to move the funding forward and actually get the fiber actually placed in the ground. Second, remove barriers to deployment. Very high priority for us because there are examples across the country where states have removed barriers that may not be popular, but they have removed those barriers. And because of that, they've been able to expand their broadband capabilities exponentially. So that's very, very dear to us. And then, of course, increasing access to funding, and then integrating emerging technologies. As I say, as we all know, technology changes hourly. So trying to keep on top of that and work with those designing technology to respond to a unknown situation in this, as Mr. Knopp pointed out, in our frontier state. We have an environment that is almost second to none that we can provide and allow them to play in to make further enhancements for the world. And finally, Broadband 101, that comes to the education piece, and that's not as a little bit different to the joint ed we're speaking to. It's more user education. And it's something I believe Senator Ellis was kind of addressing is getting that knowledge out there that while you might have broadband at your home at a 3 or a 5 meg because that's what you can afford, be able to have the knowledge or provide the knowledge that you can look at that and go, well, if I'm doing all these things and working from home and have my 3 students at home as well, is that enough? Why is my connection cutting out? And providing that information to help our citizens understand maybe what they need moving forward. Next slide, please. And this is part of it as well. Service standards. We've established the speeds at 25.3, moving forward on reliability, redundancy, and latency. Reliability, again, it drops, it's no good. Redundancy for our most of our providers provide redundancy on the back end that most of us will never see. Just verifying that and helping our providers build that into our plans moving forward. Latency, that refers to different solutions, primarily satellite. A lot of the latencies in that solution are not viable for distance learning. And some of you have seen that. I know we have senators that are on satellite as well. Funding, again, matching the finding loans, grants, matching funds, working to find the funding necessary to support the vision moving forward. And I believe this number Senator Ellis was also looking for. Current estimates exceed $1.2 billion to deploy 25.3 service to every location across Wyoming, currently without the level of service. Now that number does not address any location that currently has that service for further expansion. This was estimated as recently as 3 weeks ago by GeoPartners. Local government participation, being able to be available to help partnerships, dig once policy, model standards, and working with local government to help with the successes of deployment. And finally, the foundational support to be the foundation to which to build success. As we all know, a solid foundation may take a little longer to assemble, but it ultimately makes construction much easier. Next slide, please. Current success stories, I'll go through this quickly in an order of time. Basically, since January, I've been able to work more diligently in getting the broadband data. Been working on the final development on the broadband grant applications to get that money on the ground where it needs to be. The collaborative efforts that we've started since January, you can see the list there, and that is not all inclusive, as well as the broadband plan developments on multiple counties across the state. We have identified different areas of funding for different solutions across the state, including Department of Defense and Homeland Security. Have provided many hours of input to our congressional delegation, the governor's office, you as legislators, counties and cities and citizens across the state. Next slide, please. Finally, the 2020 Wyoming Broadband Data Initiative. This is a collaborative effort to collect statistical meaningful data. And I stole that, give all credit to Teal Wyckoff at the Geographic Information Science Center at UW. So what this is going to do is it will give us data-driven analytics that will allow us to apply a calculated solution moving forward. This information will also be imperative for all federal and grant loan programs, the Wyoming Broadband Grant Program, provider reporting. They will actually supply us with data, as you'll see here in a minute. It will supply us the information we need to know for terrestrial broadband coverage of what we have, what we don't have. Service availability. Not only will it allow us to see what is or isn't there, it'll allow us to know how much is there. I'm coming to you live from Bags on a fiber connection that I could get gigged to my home should I desire. I don't need that much, but I can get it, and it's because of the efforts that have been made previously. Further with that, outage reporting, should we get the map developed far enough, we could actually provide outage notifications on a map basis. And then further to reiterate, the broadband availability information will be supplied by the Wyoming broadband providers themselves. And this is in collaboration with the Department of Ed, the Wyoming Business Council, the Geographic Information Science Center, and ETS, everybody, with the exception of Teal, everyone you have here today. Next slide, please. This is where we're at. This data here has been gathered since 2018. And out of that data, we've had 2,800 respondents so far. And you pick your location and see where we don't have the information. That's where we need the information. Red indicates no service as of the time of collection, which could be as late as 2018. This is what we're moving forward. This is part of the map that we're moving to upgrade to provide the data that we need. On top of this layer, I will say that we have reached agreements with our broadband providers that they will overlay their own provided data on top of this map so anybody can see exactly where they do or do not have coverage and who it is. So that's in the works. It's not published yet, but Teal's working very diligently on that. Oh, next slide, please. So that was on the data gathering section. This is on the education grant opportunities specifically. Currently, the USDA had rural development was awarded $25 million out of the CARES Act funding for to add to the existing distance learning and telemedicine grant program. That grant program will provide funding for any audio, video, and interactive equipment, terminal data equipment, computer hardware, network components, inside wiring, just about anything you can think of you might need inside of a building to make remote learning, telemedicine, however you would fit it into a building and make that possible. The application deadline is July 13th, and I know there's several agencies looking into this on how we can get it to apply. The next one is the FCC and Department of Ed. They're working together on promoting rural education so students can continue distance learning. That program, from what I could come up with, has $16 billion in it. I think it's part of an additional program, but there's significant monies there to navigate that one. We don't have ideas on how to navigate that, but it is available. And I believe that's the last slide. Yes, thank you. So with that, I'll open it to any, I'll stand for any questions.
Representative Paxton.
Thank you, Mr. Chairman. I have a question for Ryan. Back a few slides, you have a priority list, priority recommendations. And on that, number 2 is remove barriers to deployment. I'd like to know, what are those barriers in Wyoming?
Go ahead, Ryan.
Oh, sorry. Thank you, Mr. Chairman. Representative Paxton, those barriers are basically service access, being able to place cable where it needs to go, whether it be in the ground, on power lines, in alleyways, anywhere we need to go. That is significant. As was addressed earlier, the permitting processes on top of that are significant, and how to get involved with those and streamline those on a state level, and then also support with other states, other Western states, on how to streamline that moving forward as far as public lands as well. Does that answer your question? Sorry.
Follow up, go ahead. Mute. Hey, Jerry, you're muted.
There it goes. All right. I'd like to know what other states have done to remove some of those obstacles or those barriers.
I've been supplied with specifically, I'm sorry, Mr. Chairman.
You're good.
I've been supplied specifically from our neighboring state to the south, Colorado, on electrical easement changes. They enacted for themselves, I can't remember the exact year, but changes to the electrical easements that would allow for fiber attachment and deployment of broadband. And that at the time I worked down in the Colorado area, and it was a game changer on the western side of the state.
Follow up, go ahead, Jerry.
Mr. Chairman, I'm wondering if it'd be appropriate to ask LSO to check out what Colorado has done so that we can take a look at it. Maybe that's an avenue we might want to pursue.
I agree. I think that's a great idea.
Mr. Chairman, I do have that information. I can supply that.
Please share it with Matthew, if you would, please. Wilmarth. Senator Landon.
Mr. Chairman, thank you. I just wanted to remind the representative from the mother county that Corporations Committee will be taking up some of this as well next week. And loved his question because it was exactly the question that I had, Ryan, which was, you know, what are the barriers and are any of the barriers us? In other words, if there are some statutory concerns, and it sounds like you hit on a big one, you know, we really could use your advice on where those are, what the impediments are, so we can get them out of the way, or at least have a policy discussion about why they exist. So, you know, anything you can do for us on that front would be really appreciated. Thank you, Mr. Chairman.
Further questions from anybody? I have one for ETS. You get about $18 to $20 million a year from the school foundation. Where's that money go? What do you use it for?
Mr. Chair, and Mr. Chair, sorry. What I would tell you is that goes into the unified network for the education side of that. And I can let Jason give more specifics, but that's the short answer.
Short answer works. That's just what I was wondering is.
Okay.
Go ahead, Senator Rothfuss.
Thank you, Mr. Chairman. And I missed a little bit of time, so if I'm running over any previous material, I apologize, but I do have a couple of questions. The first is with regard to, we had a program a number of years ago that when we were doing school facilities work, that we would try and ensure that conduit was being laid. We had that discussion. We emphasized that. I don't know that we ever codified it. And I'm curious whether that is still something that we're doing. Is trying to ensure that we always have double connectivity conduit going to any of our school buildings, or basically when we have the ground opened up, are we doing something like that?
Who wants to take that on?
All right, I'm going to guess no. So
that might be bad news, Senator. That when you don't get an answer, that's not good.
Right. Let's go with, hey, we should do that again. Similarly, with our state building commission, and Senator Landon has been engaged with them for a lot of years as well. This is something that we talked about a number of years ago, was ensuring that anytime we're digging up ground, that we're putting those opportunities there, even if we're not laying glass, that we provide that opportunity. So it sounds like if we were not doing it for schools, we're probably not doing it on the SBC side. But the next question is then getting back to Department of Transportation projects, where we had this conversation before. Has there been any follow-up on that? Department of Transportation projects, anytime we're doing major digs of laying conduit and increasing that availability for almost no cost?
There was no discussion along those lines.
Are we doing any of that? Maybe that's where we need an appropriation as our first COVID-19 related broadband appropriation, is conduit for projects. I apparently that slipped through the cracks. We were talking about it a few years ago and I didn't follow up. All right, I'll stop with that and see if there's any more discussion on that. I have a different line of questions, but I don't know if anybody wants to weigh in.
Representative Brown, you had a question?
Thank you, Mr. Chairman. So I guess I kind of want to piggytail off of Senator Ellis's remarks, and also Senator Hutchings a little bit ago about the state pursuing something that maybe the private sector could be doing. And I think that there's been some real serious discussion about whether or not there's a return on investment for that. But what I failed to see during this entire meeting here is the private sector brought forward. We've got nothing but government here talking about this. We've got nothing but government having the discussion about what government can do. And I mean, we have really good relationships with, especially the probably the largest group of people out there is either Spectrum or CenturyLink across the state, that I feel like should be at this table and should be at this discussion. And going off of what Senator Rothfuss just stated, you know, we're going to lay the conduit. I feel like that's maybe something the state should be doing, should be looking at. Okay, that's great. We can lay the track work for this kind of stuff to go through. But I guess my question ultimately lies in what kind of discussions have we had and maybe Gordon, this is for you or maybe somebody else, but what kind of discussions have been had at this point with the executive branch and our private partnerships, and why are they not doing what we're trying to do right here? What is their reasoning if you guys have had those discussions? And is this something that we can take a step back and maybe these private partnerships, I just, to me, it seems like they're just waiting for a contract to come in. It just seems like they're going, oh, well, the state's going to pay for this. Hell, we'll do this. We don't have to sink any money into it and we're going to get paid. Why in the hell would we not do that? So to me, I just kind of curious what discussions have been had up to this point and why is the private sector not jointly venturing into this anymore?
Go ahead, Gordon.
Okay, thank you, Mr. Chair and Representative Brown. So from an ETS perspective, we've had conversations with our providers that we have under contract for the state network because we haven't looked to expand into compete with them, if that makes sense. So, and then internally, we've had internal discussions with the executive branch about a number of different options and things that could be brought forward. And to that end, I'll leave that inside of that channel because that's to roll up to the governor and his purview as to what we would consider moving forward and what we wouldn't. And we have yet to submit formal details to the governor's office on that. We've just had informal discussions to this point. But I do agree with where you're at and what you're talking about. Let me be clear what I agree with is to the best of our ability that we can leverage the private sector. That's what we ought to be doing, right? Because they should be bringing these services in. But that's where we go back to, do we know the situation? Is it a situation where there's not a business case? And you know, if I use my in-laws' hometown of Yoder, right? Maybe there's not a business case to bring broadband into Yoder. There's just not enough. I don't know the answer to that question right now. Then is that something, and this is just amusing, this is not a policy statement, this is not me advocating, then is that something that we look at as a state and say, okay, if there's not a business case, do we need to somehow help out with that to get broadband to Yoder, right? I had just until recently, I had a 98, 99-year-old father-in-law there who telemedicine would have been very beneficial for, but broadband wasn't available in Yoder. Is that something we're thinking about? That's beyond the scope of ETS and my role as CIO, but as a human being, that's a question I just have. So what I would offer for your consideration is we haven't had discussions to this level with private sector other than through the Broadband Council, which is the subsidiary of the Wyoming Business Council. And that happened prior to Ryan coming on board because Ryan came on board about the time COVID hit and then a whole lot of meetings sort of got shelved. But those discussions, sometimes they were interesting, right? Because the ISPs to varying degrees felt the conversation was somewhat threatening. And so I don't know where that, and I'm not trying to put words in their mouth, but they were like, hey, wait a minute, that's something we should be doing. So we heard from them that they want to be doing this, but the detail to what they were going to do or not do is beyond my experience. I wasn't involved in those details. So forgive me, I probably overspilled on my answer there.
Thank you. Go ahead and follow up.
Just a quick follow up, and not necessarily a question, but maybe a request that if the education committee and maybe Chairman Landon with his group over there in corporations where this is probably way better suited, you know, maybe we can get those players to the table the next time we have this discussion. I'd like to be able to ask them those questions. And if this committee is going to have that as our purview and what we're looking at doing for education, it might be beneficial for us to have the availability to ask some of those questions as well. But Senator Landon, I would just ask that maybe we might be able to ask those, have you and your committee with corporations ask some of those tough questions as well.
Go ahead, Senator Landon.
Chairman, I really appreciate the representative. Agree with everything that he said this morning. I would offer, Mr. Chairman, after next week, I'll see to it that staff can maybe forward some of the information that we will gather with our corporations meeting. And of course, we have a broadband subcommittee meeting on Monday. So we will have about 3 days next week of some of our colleagues listening in, and I can tell you that the list is pretty extensive and fairly long, representing all of these industry folks. Interesting, Gordon, I agree with you. I think there's some concerns before we even get started visiting about it. It certainly has come up already that there are concerns that the private sector should be handling all of this, and I think most of us legislators have a good understanding of that. So, but anyway, Mr. Chairman, I'll make sure that that information gets shared.
Thank you. Go ahead, Senator Coe.
Yeah, Mr. Chairman, it's my understanding that we do have some private industry folks in public comments, so I look forward to that. Thank you.
Yep, I'd like to hear public comment too. Ryan, you have a comment?
Yeah, I do have a comment to a lot of that in the position. While I only have started in January, a lot of the groundwork was laid and the relationships are there with through the Wyoming Telecom Association to all the Wyoming-based independent providers, the Business Alliance, CenturyLink, Charter, the list goes on. I talk to them pretty much all, at least generally weekly, and consult with them on different issues that come up. You know, areas that I learn of lack of connectivity across those counties. Those broadband plans are to help address issues and non-connectivity on within those counties. And part of the thing, one thing that I've stood a long time on this is we're trying to address education, healthcare, et cetera, over broadband. And the lion's share problem of this is we don't have the tracks to get the train to the station in those locations, aka we don't have the connectivity to the home. And until we have that, you know, and I understand that's what we're working towards. And as far as what the state of Wyoming has been trying to do is the $10 million they put aside to do that. And with that comes the barriers that were addressed also in deploying that funding, because it's not, it is very encumbered, not only from the legislative side, but from the constitutional side, and to be able to move that forward and quickly. So as we move forward and resolve that, I hope to offer solutions. So thank you for coming.
Thank you. Senator Rothfuss, you have a question?
Thank you, Mr. Chairman. Yeah, kind of two questions. The first is a little bit about the discussion that we're having. I know we'll have some public testimony, but we tend to go with what industry wants, and there's good reason for that. But at the end of the day, industry doesn't want Wyoming to be the #1 most connected state in the country with the best internet and the best connectivity. They quite frankly don't care. They just want to make a profit. They're looking for places to make their money, and Wyoming is not the best place to do that. So they do what makes financial sense for them, which is the right approach for them. We have a different mission, and we have to find a way to enable that mission, which is we really do want the best internet. We want everyone to be connected. We want to excel. So the idea that we don't have a role in this and trying to find ways to finance it, trying to maybe put in the conduit, look for ways that we can build the public-private partnership and make it easier and lower cost for industry to get involved, that's on us. That's not on them. So as we're looking at potential uses for COVID funds, I think we do need to do things like what Representative Brown was talking about with conduit and finding ways to figure out what it is appropriate for us to build and for them to utilize, rent, whatever the case may be, kind of working hand in hand. But at the end of the day, they don't care if we're 48th in the country or first. They don't care. They have no reason to care. Maybe some of them do because they live here, but by and large, the corporations and their boards of directors aren't saying, boy, we sure need to figure out how to get Wyoming #1. That's totally on us. We're the only ones who are going to be talking about that. So if we're not taking action doing that, nobody else is going to. That's the first thing. I just wanted to make that statement, and we'll hear from folks in public testimony. But a question I do have on a separate topic. Oh, Gordon, you want to respond to that? Go ahead.
Oh, not respond to that. Oh, Mr. Chair.
Go ahead, please.
Thank you. I was just wanting to speak next. I apologize.
Okay, this is an entirely different topic. If you wanted to address that, please do that.
It's not in response to what you just said.
Gotcha, thanks. So the next thing, though, is looking forward, and I didn't see anything, maybe you already talked about this, but as we start looking at a 5G layout and we're looking at last mile problems and trying to manage some of the things that will always be challenges, I'm curious if ETS has gotten involved in the discussion of what an appropriate 5G looks like. And I say that because I'm worried that not all 5G technologies are created equally. And T-Mobile's 5G at 600 megahertz probably works pretty well for Wyoming, doesn't necessarily work as well in other states. They'll want the faster millimeter wave, higher bandwidth, but we like reliability and we like the ability to have operation over distance. So I'm just wondering, where is ETS at in that conversation? Are we trying to reach out and help shape that technological advancement, or is it just what the market does?
Go ahead, Gordon.
Mr. Chair, Senator Rothfuss, in response to your comment, we've been involved through the Wyoming Business Council or the Broadband Committee under the Wyoming Business Council and those conversations. And Jason Miller is our representative on that, and he's done some work in that area. So he may be able to expand on my answer. But the short version is we've looked at the opportunities that are there. And you laid it out as eloquently as we would, in that 5G is a sexy new term in the cellular world, but it is not necessarily the same thing from vendor to vendor. And in Wyoming, we would struggle because 5G is a high density deployment tool, right? It's short distances. And in Wyoming, we need longer distances. So I would leave it at that for now, unless Jason, you think there's something relevant to the senator's comments you'd like to respond to?
Mr. Chair, I agree with you. I think you're spot on that. I would again, beat the drum a little bit about the fiber build. Even when you're talking the lower level of 5G connectivity still requires that high capacity backhaul from those towers. So again, like I said, not to continue to beat the drum of building that foundation of fiber. I think that's important, and then that builds on whether it be the small cell millimeter 5G in the urban areas or the lower level 5G. I think that's an important piece.
I'd like to go to public comment and then we'll go to lunch. So Gordon, do you have one more comment?
Yes, please. Thank you very much, Mr. Chair. The comment I would make is that we've had a couple of questions here about how is ETS engaging the public sector, or I'm sorry, the vendors. And I want to be clear, our conversations have been limited in scope to the unified network because we have not wanted to get into the conversation. We didn't feel it was statutorily our role, and we didn't want to overstep to talk about how we ought to build out to homes and things like that. So we can have those informal conversations, but we have not had that as a formal conversation. We've let that be a conversation through the Wyoming Business Council and those channels. The other thing I do want to just make everyone aware of, and forgive me if you already are aware of this, when we talk about data, and I'm a big fan of data and having information on which to base decisions, there is a challenge here when we look at coverage maps and when we talk about where do we need broadband. So vendors have their coverage maps and they'll say whatever coverage they say. And we find, and we all find this, right? I'll give you the example again of my father-in-law in Yoder. Most of the vendors say they provide service to Yoder. However, when we tried 3 different providers at his home, we weren't able to sustain service, right? So there's a difference in what a vendor believes they provide and what users experience. And Ryan had mentioned that in that map that TL Wyckoff and UW maintains, where where individuals in Wyoming are reporting their experience. So I think we have to balance our data between those two because they're both true, but I don't know which one is the truth with a capital T. So I would put that for your consideration. Thank you for the time.
Thank you, Gordon. All right, we're gonna move to public comment, and we have 2 people, Jason Hendricks and Liz Zerga. Who would like to go first?
Hi, this is Liz Zerga. I'd be happy to go first.
That'd be great. Go ahead, please.
Great, thank you, Mr. Chairman. Liz Zerga on behalf of the Wyoming Telecommunications Association. I don't often find myself in front of the Education Committee. I know a number of you do know me pretty well from our contacts through corporations and other areas. I represent 9 rural carriers. So think of us as you do when you talk about the rural electrics. We serve about 35–40% of the geography in Wyoming, the most difficult areas to serve. The YTA carriers consist of companies that some of you are familiar with, perhaps not all of you. So I'm just going to run down the list. It's All West Communications. They serve down in the southwest part of the state, the towns of Evanston, Green River, Rock Springs, Cokeville. And then the range companies. The range companies have Du Bois Telephone, ACT, Range, and RT Communications. They serve rural areas all over the state of Wyoming. Their territory is pretty scattered. Then we have Silver Star Communications, which is up in the northwest part of the state. TCT, which serves the Bighorn Basin area, including Cody, Grable, Powell, and a number of other rural areas. And then Union Telephone Company, which serves down in the south part of the state. They're also a very large mobile wireless presence in the state. So those are the 9 YTA companies. And first of all, I want to talk about how the companies have been handling capacity and those kinds of things during COVID-19. Their networks are robust. They have very robust networks with high capacity. They have not seen problems. They have been able to respond to problems. These small providers are fiber intensive providers. And we'll talk about that in just a minute. I've listened to a lot of the comments about what carriers want to do and don't want to do. I assure you, these small carriers, they live and they reside in the communities. Their boards are in the communities. They want good service for everybody and they provide good service for everybody. But before I get to that, let's talk about what they have been doing to help customers during the COVID-19 response. And this is some of the data that I think Senator Ellis wanted. We don't have all of the data for the entire state because obviously we serve in the areas where we serve. We have that data, so we'll talk about that. The first thing I want you to know is that the YTA carriers, along with many of the other carriers in the state, all voluntarily signed on to a pledge that the FCC asked carriers to sign on to. And that was that they would not terminate any service to residential or small business customers because of the inability of those customers to pay during COVID-19. They also agreed to waive late fees, and they also agreed to open any Wi-Fi hotspots that they had for free for use by customers. This pledge is carried through the end of June, and all of the carriers made that pledge. Mr. Chairman, members of the committee, right now these rural carriers are collectively, and this is an undercount because I could not get numbers back from every carrier in time, they're collectively carrying over 1,500 accounts that are unpaid. That is one of the issues that we are going to address with the Broadband Task Force. We have asked for a bill to address the ability of consumers who cannot pay their broadband bills due to COVID-19, that the state subsidize their broadband, that they give those customers a voucher to be able to pay for broadband. So we'll address that with the Broadband Task Force. It may end up going through Corporations Committee or Management Council, but that is one area that we are very aware of. Another issue that arose is some of these small carriers reached out directly to school districts when COVID-19 hit and the schools closed. Others received communication from school districts. Not all of them did. So for those carriers who either reached out to the school districts themselves or had the school districts contact them, they connected over 600 students who were not connected, who were could have had broadband connections because the network was there, and for one reason or another were not connected, be it due to lack of a perceived need to have a landline connection in order to, use Zoom or other technologies, or because they lack the financial ability. Many of those student homes and in some case, teachers' homes were connected free of charge. And they were connected, and that service was provided through the end of the school year. So the other things I want to talk about now are the things that were raised more recently, and these aren't, or would you like to take questions about the education, connecting the students, and the lack of financial ability of some of our customers, before I talk about what the carriers have done to build out broadband and what they are doing to build out broadband.
Questions from the committee for thus far? I think you're good, Liz. Keep on going.
Thank you, Mr. Chairman. So with respect to what my carriers have done to build out broadband and what they are doing to build out broadband to that last mile in Wyoming, these carriers have invested over $200 million in the last decade in extending their networks and reaching out to try to connect customers. Most of these small carriers are participants in federal programs, and those federal programs have federal funding programs to reach the most rural areas. And most of the carriers have recently elected to be in a program called Connect America Fund, ACAM. That ACAM program was stood up in 2016, then more money was put into it in 2018, and it was revamped in 2018. So most of these carriers are now ACAM recipients. They elected to be ACAM recipients. And that ACAM requires them to build out additional areas to unserved customers. And it's a specified amount per year. And so the carriers have 10-year commitments for build outs. And so these carriers all have a path forward. Will it reach every single person, every single household? No, but it is a major path forward. The other thing I will say is about fiber. I do agree with the commenters about fiber. My carriers are fiber intensive carriers. We have 19 communities, and these are small communities for the most part, that are fiber to the premise. You heard the broadband coordinator, Mr. Kudera. He's in Baggs, Wyoming. That's one of the rural carriers, Du Bois Telephone, fiber to the premise throughout Baggs, Wyoming. Fiber to the premise throughout Du Bois, Wyoming. Fiber to the premise, Worland, Wyoming. Fiber to the premise, Thermopolis, Wyoming. I could go on and on. There are 24 communities that have fiber to the premise, and that's investments that these carriers made. There are additional plans and commitments to put more fiber to the premise in communities. The expense of fiber, it is expensive. And with COVID-19, and with ACAM that I talked about, ACAM is a national federal program. A lot of the fiber contractors are very, very, very busy. We compete with each other. My carriers compete with each other to get those fiber contractors. But they all have projects that they are building this year, fiber to the prem. They all have projects the following year, fiber to the prem. They're reaching fiber further and further out in their networks, and they have not only world-class service, gigabit service, symmetrical, in many of these small communities that they have fiber to the prem. They are pushing that network out further and further. So we are a solution. We are a good private solution, and we're working very hard to be that solution. With respect to the ideas put forth by ETS, I have concerns. The first concern is one, and I'm not an expert in this area, but I would ask the question. Some of that network was funded with E-rate. E-rate funded network has FCC restrictions on about what it can be used for. Right now, I know there's an FCC order that says that schools certainly can put out Wi-Fi for the school premise for the use of the students. Once you get beyond that, talking about point-to-point wireless connections to serve rural areas, I would ask about what happens to E-rate funding. And E-rate funding does support that network. So I would ask that question. I feel like I've hit on some of the high points. I'm imagining there are a lot of questions, and I would be happy to try to answer whatever I can. But I guess the point I want to leave with you is that we are more than happy to be the solution. And we're not just fiber carriers. We have fiber, we have cable, meaning cable TV assets. We have wireless assets. We do fixed wireless. Some of the carriers do mobile. We're pretty familiar with all of the technologies. Our serving areas are well covered. We've moved out into the bigger carriers areas in the areas surrounding our areas, and we've moved to the bigger areas, larger communities to provide fibered service. How can we help? We're happy to help, but we do have good service. We are building, and I think we are the solution in our areas, not the government.
Very good. Thank you, Liz. Go ahead, Senator Rothfuss.
Thank you, Ms. Chairman. Hi, Liz. Good to see you in this committee.
Hi, Senator Rothfuss, Mr. Chairman. It's good to see you too.
Liz, so you know, and I don't know whether it'll come through this committee, it'll come through the broadband task force, but at some point we obviously want to improve our connectivity, want to improve the fiber, want to improve the capacity of the state. And we can't just hand you and your company's money to make that happen. So when we're talking about public-private partnerships, what does that look like best? I know you and I have talked about conduit before as being kind of a non-threatening approach, if only we were doing that in every project we did. Do you have any more to add as to in a way that doesn't lead to de-investment from industry?
Go ahead, Liz.
Mr. Chairman, Senator Rothfuss, there's the short-term version of what you can do, and then there's the longer-term version. So the short-term version, I'll tell you, I'm hearing that some legislators want to take CARES Act funding and actually put it to private providers who would, I don't know what the mechanism will be. I don't know if it's, this is not something we suggested, it's something we've been told about. We're amenable to it. But we don't know what the mechanism is. I think it's something that's going to be talked about in the broadband task force, identifying areas that need service, putting it out for some kind of an RFP with CARES Act dollars. It has to be a short, fast, quick fix. So there's that short-term answer for the short term. The longer term, what you can do is a couple of things. And we've and let me get back to the short term. We also ask that you set up a fund with CARES Act dollars to support those customers who for financial reasons cannot pay their broadband bills. Because if we can't keep our current customers, how can we help you build to get other places? So those are the two kind of short term. Longer term, one of the things that can reduce expenses for us and delays is permitting. And we usually have about 11 or 12 entities that we most often deal with, different permitting systems. Some of those are state, some of those are county, some of those are local, some of those are federal. Our biggest problem is federal. It has been. We have projects where we have money, funding, could go, fiber, get it to a community, 2-year delay, 3-year delay, BLM. And we have tried, we're up against a wall on that. I don't know what else to do about that. But we have suggested to the broadband task force that they consider centralizing the permits, at least of the state and the county, and giving some clear, like standardized language and putting some kind of a time frame on it. Because we get told sometimes, well, send your permitting through the state, YDOT's pretty good. YDOT is really pretty good. Send your permit through YDOT, and if you have to talk to Game and Fish, go through Game and Fish because there's a sage grouse. And then after you've gone through all that, we'll start your permitting process for the county. We would like some kind of a one-stop shop for state and county permitting that's centralized and preferably electronic. We're broadband providers. We deal with electronic, and we would like it to be streamlined. That would help us a lot in terms of time and would help reduce cost for us. But in terms of getting the fiber out there, fiber is expensive. You know, I asked my carriers for recent quotes regarding what does it cost to put in a rural mile. Let's talk rural mile versus urban mile. What is the cost for a rural mile of fiber? And I want to grab those numbers here if I can. I was told that right now, today, in more recent costs, excuse me, Mr. Chairman, while I pull through all this paperwork, the rural mile cost today for lit fiber, that's for the glass to be installed and to be lit, have the electronics on it, is running between 70,000 a mile to 85,000, sometimes as high as 90,000 a mile. And then when you get into the urban areas in Wyoming, that means in a town where you have pavement, it's like, you know, it is as much as 160,000 a mile for fiber. But you're right, you need fiber for all of these technologies. The more you push fiber, the better your wireless connection is, the better chance you have at a 5G, the better your cable system is. If you have a coaxial cable, the better your wireless system. So fiber is the bedrock, and we know fiber.
Thank you, Liz. Any more questions? Okay, can we go to Jason? And
good morning. I guess it's afternoon now. Mr. Chairman, members of the committee, thank you for the opportunity to speak with you today. My name is Jason Hendricks. I'm the Chief Regulatory Officer for the Range Companies. And as Liz just spoke, that's Range, RT, DTE, and ACT. We provide broadband throughout the state. With respect to the unified network, which has been talked about today, our carriers provide the connections directly to the schools and all the communities we serve. And then ACT, when the new contract goes into place, will be the provider of the majority of the pieces of the backbone for the unified network. And that's the 100 gig components that provide the backbone throughout the state. We are primarily fiber providers, and we serve very rural areas. Our average customers per square mile is 1.16, so very sparsely populated throughout the state. And we do receive federal ACAM money, as Liz mentioned, just a universal support mechanism for deploying broadband networks. It's designed to be for build outs in areas that are less than 25.3. But when we get the money and we build the networks, we're building fiber to the homes, fiber to the businesses, and it's gigabit capable services. With respect to the FCC pledge, we did sign that pledge to not disconnect customers or to waive any late fees. We've opened up free Wi-Fi hotspots, but we also did go beyond that pledge. And for connections to students and teachers, we reached out to all of our local schools and asked them for names of students who didn't have broadband connections, and teachers in some cases too. So we reached out and provided connections for free through the whole school year for 270 teachers and students. So it should be pointed out that there are a lot of reasons why people didn't have access, broadband access. It could be affordability issues, as was talked about before. It could be because they were relying on certain kinds of technologies that may not be the best when it comes to Zoom kind of meetings, for example. There were cases where we weren't able to connect certain students. A lot of it is because of the expedited nature of what was going on and some of the restrictions on being able to go into homes. But we connected a lot, and certainly have a commitment to our education in our areas. Few responses on the presentation by ETS. I'd like to echo a lot of the comments made by committee members on private solutions being preferred. We fully agree with that. We provide connections in very rural areas, and we have, like I said, we're receiving support to add connections, and we will continue to do so. There are also, besides our technologies, there are other private entities out there too that are providing fixed point-to-point services. So we think that there are solutions out there to the extent that there are still gaps. We'd like to work with ETS and try to find some private solutions for those. I will thank ETS for what they did put together on at least trying to limit the scope for some of their proposals. But as Liz pointed out, there may be some E-rate issues to be considered as well. I'd also like to point out that there are a number of federal programs that are in place or will soon be in place for broadband last mile connections, education, telehealth. And so I just ask the committee to pay attention to what's out there, what's available for the state, and take advantage of those when they can. One other thing with respect to the ETS network, as was pointed out during the presentation, this isn't just an initial kind of setup. There would be ongoing costs associated with both of those solutions. And just keep in mind some of the state budget issues with that, and then there may be CARES Act limitations of what can be used for some of the ongoing kind of stuff. Lastly, just a couple other points, just in response to some of the committee member discussions. We are very committed to the areas that we serve. We live and work here in the state. We have close to 100 Wyoming-based employees. We have 12,000 plus broadband subscribers, 4,700 miles of fiber. We serve 30 communities. We're planning on doing $150 million of fiber investment over the next 10 years. We are Wyoming companies, and we are very committed to this area. And so we do care if we're 48th or 1st, and hopefully we can get a higher ranking. So yeah, we're committed to that. Last thing with respect to maps, Mr. Kudra talked about what's going to go forward as far as upgraded maps, and specifically, we're going to be going to an approach of shapefiles, which are basically, we put polygons around areas that we serve, and it'll be specifically tied to our serving areas. So some of the limitations with the federal mapping and the current state mapping that was based on some of the federal mapping, it's based on census blocks. And so certain census blocks can be shown as served when only part of them are served. So as we go to this new kind of shapefile mapping system, it'll be much more accurate on where we serve. And I think that'll very much help some of the issues that Senator Ellis was talking about too, as far as what are the problem areas, and let's target our solutions towards those problem areas. So with that, that's all I have, unless you have any questions for me.
Questions for Jason? Go ahead, Representative Fletner.
Mr. Chairman, thank you. Not a question, just a comment both to Jason and Liz and the companies that they represent. I just want to thank you for stepping up and doing what you've done to help our kiddos during this crisis. I had a college student who came home, and our local broadband provider hooked up his house here on the ranch at a discount, and they just were Johnny on the spot to help him get connected to finish his education. And we also have a local group of economic development folks who have had many conversations with local broadband providers to try to find solutions to help, like our little community of Shell, which I am nearest to. And at the end of the day, it's still a private company. And if it doesn't pencil out, it doesn't pencil out. And I think that most people understand that. And I like what you had to say about maybe trying to find solutions to where we could streamline the permitting process. That would be, I think, a much better way for us to try to help find, an answer to these problems. So thank you again, and please thank your companies that you represent. Thank you, Mr. Chairman.
Thank you. Anybody else? Any questions for Jason or Liz? All right, committee. It's 12:31 by my time. Let's see if we can have a short lunch and get back here at 1 o'clock. How's that?
No.
Thank you.
Mr. Chairman?
Yes, sir. Go ahead.
I'm gonna weigh in on my new philosophy on Zoom meetings. These short lunches that I've had all week of 30 minutes don't help my sanity. I'll just say
Right.
that. So maybe 45 minutes at least, maybe. That work?
Gordon, go ahead.
Mr. Chairman, I just wanted to clarify, I believe we're done with our section of this. Are we excused?
Yes, sir.
Thank you very much. Have a good rest of your day.
Mr. Chairman,
Yes, go ahead.
I was just going to say, so is it when you make state senate, is that when you start getting back on time with the right, we start having good timing on this is when you're chairman of the Senate Education?
Yeah, we'll find out. All right, we'll be back here at 1 o'clock. Thank you.